All the women, wanawake wote wako hapa, let's all rise to our feet. All the women. The reason why
Good morning, everyone. And thank you so much, Ian, for such a warm introduction. As introduced, my name is Esther Masharia. I work for Smart Applications. I'm in charge of healthcare service providers. I run the strategy within Smart, just to make sure that you guys are very well taken care of. I have worked for Smart since 2008. It is the only company that I have worked for, so I only know how to do Smart. So I'm very privileged this morning to be here in presence of our esteemed guests. It's a region that, are we good? Okay. So it's a region that we're really very honored to be, because it's actually our biggest region in Kenya across the providers where we are in, a region covering of 8 counties, with at about 12% of our coverage sitting in this region. So we are very much honored to be here. So I want to take this special opportunity this morning to sincerely appreciate all of you for coming. You have made this day such an awesome day. It is indeed a show of true partnership, which has come a long way between you and our Smart Applications. We have walked this journey with you for the last 21 years. Through this partnership, Smart has today spread its wing into 11 countries, and our system is in use in over 7,000 healthcare service providers. Without you, this would not have been possible. You have demonstrated a spirit of true business partnership, collaboration, and a shared purpose. In line with our commitment to continuously innovate and elevate our customer experience. Earlier on, Smart introduced our Smart Virtual Access Platform, a process that was very successful because you collaborated with us to see that innovation to right. Thank you all very much for the continued support. We remain steady in this journey with our forward roadmap of innovation on patient-centered strategies in all our solutions. Today marks a very important day as we meet to share with you our journey so far, what we have in store for you into the future, starting now. Please feel free to engage our teams, both within the tent and the stores, as we onboard you onto an amazing experience that seeks to transform healthcare delivery through innovative digital solution. Thank you all for coming.
Healthcare business about smart applications. She has an open door policy, all right? And that is what has helped her to grow. And having an open door policy is making sure that you have a relationship and a conversation with the people even on the ground. And that is one thing that she does very, very well. For those who can drive a truck or you've driven a big car, when you're making a turn, it's going to be very, very hard if you're doing it at a very high car. But if you go low, like a small car down there, you can make the turns very, very well. And we appreciate your open door policy. Please, ladies and gentlemen, let's appreciate Esther one more time. Esther Macharia. Right, fantastic. We now want to go, ladies and gentlemen, to our keynote address and the person who is going to guide us on the Smart 21 years journey. I had earlier asked how many of us believe women in leadership, but let me ask one more time. How many of us believe that men can also be exceptional and good leaders? How many of us? And please do not think about your local politicians. Please, I'm just asking a general question. How many of us believe that men can lead? Let me see by a show of hands. There's a lady who's looked at me and said, "Sitainua hiyo mkono." I am with Esther Macharia all the way. All right? We want to go to our keynote speaker, ladies and gentlemen. I have the privilege and honor of inviting on stage. Our keynote speaker, ladies and gentlemen, is a beacon of operational prowess. How about that? And also strategic leadership at Smart Applications International. This man doesn't have 2 years of experience or even 5 years of experience. He has over a decade of experience. And the good thing about him is that he has been consistent, and he has consistently
Ladies and gentlemen, as partners, we have walked the journey together, and this morning, I want us to go through a couple of things, a couple of aspects that our GMD would have wished to have this morning. So you allow me, just before I go into my delivery, I'll go through the speech by our Managing Director, Group Managing Director, who is not with us this morning, Mr. Harrison Moiro. So And after that, we shall also have a video clip from him, and I know the technical team are pretty ready about it. Good morning, ladies and gentlemen, our distinguished guests from the county government of Nakuru and other guests from Rift Valley and beyond, our host county Nakuru officials, distinguished healthcare facility representatives, medical insurers, administrators, government prestatals, media, and all other stakeholders. Hamjamboni. We, Smart Applications, are honored by your presence today on this inaugural Smart Healthcare Service Provider Summit in the Rift Valley region, right here in Nakuru. Indeed, we do not take it for granted that amidst the dynamic environment, both globally and in our country of Kenya, and the demanding activities in our organizations, that you have made time to be with us. A round of applause for each and every one of us. Thank you. The healthcare agenda is a fundamental agenda in our quest for development and welfare of our people in Africa, in line with the SDG 3 on health and well-being. Last year, in the neighboring county of Kericho, Smart Applications joined His Excellency, the President William Samoei Ruto, and the Ministry of Health in the launch of UHC in our quest to contribute towards sustainable quality healthcare to all Kenyans across all levels. Indeed, the launch of the primary care networks, the new SHIF, and Chronic Emergency Funds and Health Facilities Act and the Digital Health Act are significant milestones that will change the healthcare landscape for all of us, including how you and I will interact with our ultimate beneficiary of our services, the patient. This can only be realized through effective collaboration of public and private healthcare stakeholders and use of appropriate digital smart healthcare technologies. As such, it is important for us to revisit and re-engage on the requisite partnership, technologies, and capabilities in this new healthcare landscape towards meeting the healthcare needs sufficiently in not only our nation but across Africa. From our smart statistics, Kenya is becoming a regional hub of medical tourism, attracting a growing number of patients from Uganda, South Sudan, Rwanda, and even as far as Zambia in the southern part of the continent, thus becoming a regional global leader in healthcare services excellence. I take this moment to congratulate our Kenya healthcare service providers in their commitment toward this achievement in attractive quality of care. Our Smart Service Provider Forum of Rift Valley, under the theme of pioneering digital innovations for seamless healthcare access, is focused in bolstering our healthcare service delivery agenda and is in line with the World Healthcare Day, which we celebrated on 7th of April 2024 under the global theme of My Health, My Right, aimed at focusing on the importance of equity, inclusivity, and freedom for everyone, everywhere, in access to essential health services. We, as Smart Applications, have taken to solving the inadequacies in healthcare delivery through using the power of indigenous, innovative digital solutions that are co-created with you, our healthcare service providers and healthcare program administrator, in order to transform healthcare access seamlessly. We indeed feel very thankful to each and every one of you and your institutions, because we have not walked this journey alone, but through immense local collaboration and support from you, through your contributions, acceptance, and engagement across our last over 21 years of existence. We are glad that we have jointly delivered smart healthcare technology solutions and served millions of patients. What we are going to be taking you through today in the range of smart health digital solutions is a testament of our philosophy of creating convenience through solutions that empower you, make it easy, and deliver quality, and a wow experience to patients, thus enable stakeholders to address the current and emerging healthcare needs in our population. Some of the pillars that we will spotlight on today are digitization for efficiency, access, and growth. 2, automation of controls and patient processes for cost-effective, or rather cost-efficient, better quality and revenue assurance. 3, data insights for improved data-driven decision-making and ultimately outcomes. So as smart applications, we remain committed as frontrunners in delivering innovative solutions in the Kenyan and African market together with you. Let us continue to co-create together to deliver value to our people. We look forward to continued partnership with you as we reach to these frontiers. Feel free to interact with us and any of our representatives at the forum or through our digital communication channels for further engagement. We would love to hear from you. With those few remarks, I declare this Rift Valley Smart Service Provider Forum officially open. Thank you. So officially now, we are in the forum. And I'm going to request our digital team, our media team, to bring out.
Good morning, ladies and gentlemen, our distinguished guests from the county government of. Good morning, ladies and gentlemen, our distinguished guests from the county government of Nakuru, and other guests from the Rift Valley County and beyond, our host county of Nakuru, officials, distinguished healthcare facilities, medical insurers and administrators, government parastatals, media, and other stakeholders. I'm Jamoni Wote. My name is Harrison Muru, the Group Managing Director of Smart Applications, and we are honored by your presence today on this inaugural Smart Healthcare Service Provider Summit in the Rift Valley region, here in Nakuru. Indeed, we do not take it for granted that you, amidst the dynamic environments that we face today and the busy schedules in your organization, have taken time to join us for this forum. The healthcare agenda is a fundamental agenda in our quest for development and welfare of our people in Africa, in line with Sustainable Development Goal number 3 on healthcare and well-being. Last year, in this same Rift Valley region, we joined His Excellency the President, William Samoei Ruto, in the Ministry of Health in the launch of our Universal Healthcare Coverage Program. This was in a quest to contribute towards sustainable and quality healthcare to all Kenyans. We have seen remarkable strides in this particular area, looking at how the changing landscape will affect all of us, and looking forward to the ultimate goals towards achieving sustainable healthcare through the use of public and private collaboration and use of appropriate digital technologies. As such, it is important for us to revisit and re-engage in the spirit of partnership. Where are we in our journey towards this quest and towards improving healthcare? From our statistics, Kenya is becoming a regional hub of medical tourism in Africa. We have seen there's a growing number of patients from Uganda, South Sudan, Rwanda, and even as far as Zambia who are coming to us since we have established ourselves as a regional leader in healthcare services excellence. I take this opportunity to congratulate the Kenyan healthcare service providers for their commitment towards this achievement in attractive quality care. Our Smart Service Provider Forum in Rift Valley, under the theme of pioneering digital innovations for seamless healthcare access, is focused on bolstering our healthcare delivery agenda in line with the World Healthcare Day focus, which was celebrated on 7th April under the global theme of My Health, My Right. This focuses on the importance of equity, inclusivity, and freedom for everyone, everywhere, in accessing essential healthcare services. At SMART, we are continuously trying to solve these inadequacies in healthcare delivery through the power of indigenous, innovative digital healthcare transformation solutions co-created with you in order to ensure healthcare is delivered seamlessly. We indeed feel very thankful to each and every one of you and your institutions because we have not walked this journey alone, but through your immense collaboration and support, through your contributions, acceptance, and engagement, we have continued to innovate across our last 20 years to deliver the smart healthcare technologies that you use today to serve millions of Kenyans and other Africans who patronize our institutions for healthcare. Today, we will be taking you through a range of smart digital health solutions as a testament to our philosophy of creating convenience through solutions that continue to empower you, to make it easy, and to wow your and our mutual patients in respect to quality care. We continue to work with you to address the current and emerging needs of healthcare access for our populations. Some of the pillars that we shall spotlight today include digitization for efficiency, access, and growth, automation of controls and patient processes for cost efficiency, better quality, and revenue assurance, data insight for improved data-driven decision-making. We hope that we shall contribute towards your knowledge and indeed in our engagement in partnership to continue delivering innovative solutions. We look forward to continued partnership with you as we reach out in all these frontiers. Please feel free to interact with us or any of our representatives across this forum and through our digital channels so that we can hear from you and further our engagements. With those few remarks, I declare the Rift Valley Smart Service Provider Forums officially open. Thank you very much to all of you.
Thank you, ladies and gentlemen. Let's put our hands together as we appreciate our managing director as we open officially the forum. At this point in time, I want to take you through something very quickly before we move to the next presenter. I know time I would call is very fond to my heart. About 18 years, when I was about 18 years, I came to this place on this particular grounds within Rift Valley, within Nakuru. I was right here in Nakuru High School. And I couldn't tell that after 18 years at SMART, I'll still be standing on the very same grounds. So it's quite amazing that we are here today. And I want to make a few remarks in regards to how SMART has come, our journey for the last 21 they are somewhere else in another country. You just bought the system the other day, but there is nobody to support that particular system. We know what you go through or what is going through your mind when you make decisions about the services you are going to offer. And down the line, 2 years, you realize that the investment was probably not worth it. Maybe you could have invested in a particular area. And that's why Smart, we are coming up with solutions on the digital arena, giving you insights to see where to invest and what areas to invest in order for you as healthcare facilities to grow. The real cases are many. Just the other day in one of the markets, one of the providers called us and told us, just come and replace the system I have installed. I have been with it for the last 12 months, but it is not delivering. Why? They were not able to access the provider, the person who provided the system. They were not able to get support that they needed. The system was not corresponding to the needs on the ground. But Smart, as our GMD has also said, our solutions are indigenous. Our solutions talk to the processes on the ground, to the environment that we are in. So we are here as Smart Applications to change the story. With our global expertise, Smart has been able to build digital solutions that will help to address the challenges in delivering healthcare. We are not health experts, but we work with you on a daily basis, and that has made us understand and build digital solutions that help you to deliver your services. Today, our teams have packaged a couple of presentations, and we shall go through some of them just to bring to your attention the developments we are making innovatively to help you as you deliver a healthcare access to the patients. As I conclude, as I said earlier, I was barely 18 years when I was here. Today, I've been at Smart for 18 years. I've walked this journey with healthcare facilities across the country, in this particular region, the Rift Valley, the various providers here within the town of Nakuru, the city of Nakuru, and we truly, truly appreciate the amazing development that have been made. So as I conclude my story, Smart is not just over 18 years. We are over 21 years, and we are ready to enhance our partnership in all areas I have mentioned and beyond. We pride ourselves in creating innovative and relevant solutions for our partners. Please feel free, of course, to engage us, and we are ready to engage you in order to make the experience of the patient amazing and to ensure that we deliver in line with the SDG 3, which is about wellness and healthcare. The next phase is even more exciting, and we need you even more as we move forward. Thank you for coming, and thank you for listening to me, and thank you for choosing Smart. Thank you.
class and also with poise. Please, let's appreciate Mr. Isaiah Mosiori, our group COO, for that fantastic journey, just getting to appreciate how far smart application has come from and how far we have to go. We also want to appreciate our group managing director, Mr. Harrison Muiro, who was also, we got his recording on screen, so that is also a guarantee that leadership is in step with making sure that we can be able to continue with you in this particular partnership. Ladies and gentlemen, even before we proceed, calling back Esther, I'd like to request all of us, please, if we can all rise to our feet. If we can all rise to our feet. Mr. Isaiah, that was a fantastic presentation. I'm still stuck on there. Okay, now what you can do, you can be able to just stand behind your seat, push your seat under the table just to create a little bit of space. And then I want us all to face forward, All right, great. And then I want to make sure that you have space, just some good space. All right, please look at the person standing next to you and tell them it's the smart applications rhythm. The smart applications rhythm. Okay, now this is what I want you to do, and I believe that I am visible to all of you. I want you to move your knees forward and back, forward and back. So when the right one goes forward, the left one goes back. Let me see you do it forward and back. It gives you a bit of a bounce, all right? So that is the movement that smart applications gives you. Let me see you do that. Forward and back, forward and back. Then I want you to put your fingers here. And I want you to start clicking. Now I want you to move your shoulders. It's like you're charging at someone who has had your invoice and they're not paying, all right? You forward like that, and then I want you to do this. You go down and up. Let's go. Down and up, down and up. Smart applications rhythm. Now, this is what I want you to do. I want you to put out your hand like this with the pinky finger and this other finger like that. And then I want you to take it down and up. Now that is your phone calling. Ever since you started using smart applications, everyone wants to talk to you, all right? Put it down and up. Let me see you do it. Down and up. You're opening regional offices and up, down and up. And I want to remind you that we're taking photos, so please, even if the dance is not coming through, the facial expression has to be at the right place, all right? Yes, yes, yes. We do not want you to trend for the wrong reasons. Finally, ladies and gentlemen, when you start moving with smart applications, they take you from one level to another level. And this is how I want us to do it. We're going to use both our hands to take it from the bottom like this. Down and put it there. Let me see you do it. Let's go. Down and put it there. Nice. One more time. Let's go. And put it there. Ladies and gentlemen, this is best done with music. Mr. Director, please give us that song. We want to see the smart applications rhythm. Nice. Give us all the volume. We have faith for the ground. Let me see the knees going there. Put your hands here. That we get from partnering together with smart applications. At this particular point in time, ladies and gentlemen, we want to have a discussion around the smart provider value proposition and also the product offering. To guide us on this is a lady who definitely understands this particular conversation, and we had the privilege of also having her again once on stage. Please help me appreciate with a warm round of applause our Group Director for the Healthcare Business one more time, Esther Masharia, as she comes on stage. Welcome, Esther. Glad to have you. Asante.
Thank you so much, Ian, once more. And thanks, everybody. You look so beautiful from up here. So I want to talk about what we do, and especially what we do for our healthcare service providers. So as my colleague had earlier said, we have been in operation in about 20 years, and our work is actually to just build systems. We automate healthcare access, and our mission has been to create a smarter society through world-class innovative healthcare solutions. Our mission is to inspire a world of convenience, and that is what we do through our innovative products. So our footprints, like my colleague had said, we are currently in 11 countries, serving about 7,000 healthcare service providers. Our system serves about 1.7 million members with over 6,000 schemes across the countries where we are. So our strategy has actually been to paint that map red, and we continue to do that through our innovations. What do we do for our hospitals? We create convenience. This is especially through our core product, the one that we started with, our MediSmart product, where you're able to know that the patient who you are serving in front of you is actually the right patient. Throughout the year, we've done this through guaranteed member identification through our biometric smart system, where the patient comes to your facilities, they're able to identify themselves that this is Esther Masharia, probably covered through by Britam, or whoever underwriter is underwriting your cover at that point. So we've also seen a reduction in the rates of claim rejections, because you're able to verify the benefit before service. So for example, if I'm running out of cover, you cannot be able to give me service, because the smart system is able to give you that information before you proceed to give service. And I think this has actually been what we have done and seen the expansion and reduction in the number of rejected claims from different underwriters. As I had mentioned, and my colleague had also said, we have a roaming capability. It is the only platform where you're able to see patients coming from different countries. So if you have patients coming from Uganda, from Rwanda, using the same platform, our smart access platform, the patient is actually able to use the same cover and get services at your healthcare service providers. So the virtual card is actually able to convert into the currency of residence where the patient is getting service. We have also done a lot of process optimization. Recently, we were able to automate the pre-auth process, especially for a few underwriters. We know you're able to raise the pre-auth request on the system. And I am hoping a lot of us, especially if you're running a dental facility and an optical facility, you have been able to do that. But we are expanding that to cover other benefits, including inpatient benefits, where you'd be able to raise the pre-auth through the system. It's actually approved, rejected, or partially declined, and the patient is able to get the status of their pre-auth requests. We are also able to automate our electronic data interchange process. We introduce our EDI platform where you're able to submit your claims online, and I know payers like Old Mutual are now fully paperless through the system. Of course, we continue to enhance that process to make sure that process is seamless. And of course, our other value proposition for providers is actually paperless process. Of course, through our EDI process that is able to give you capability to track your claims, track your payment process, and also have a feedback process where we are envisioning to have payment, our statement of account, done through the smart system, so that we have an end-to-end fully paperless process. We have also continued to automate our providers. I think throughout our 21-year journey, we were able to study the pain points that hospitals go through, and we now have our Smart Health Plus ERP. It's a fully fledged hospital management information system, currently running at 159 healthcare service providers. Within this region, we have at about 10 providers, and our first level 5 hospital to take that system is actually in this region. So it's a product that has been tested. We will be seeing the features of that product later on. We're also able to launch our Smart Access solution, where now we do not have the physical cards anymore, right? Or there are people who are still insisting to come with physical cards. We don't have those anymore, but we're still doing a parallel program. If they come with a physical card, it will still work. But now we moved to our Smart Access solution, which is available on the Smart Access app or using the USSD code *891#, and the patient is able to initiate their visit through that USSD code or initiate their visit through the app. However, we also have a manual process for that Smart Access, just in case somebody comes and they don't have a smartphone, or somebody come to the hospital and they lost their phone. You're able to also give them service through the manual search process. And the reason why we do that is because we create convenience. We know our service is consumed under duress, because if I am sick, you don't want to tell me there's a system that is not working. That is why I cannot be given service. So really that is what we do. Of course, we do a lot of data insight products where we are able to give you information on your quality of care. How long are your patients taking at the hospital? What is your customer saying about you? What is the payer behavior? Who pays you after 90 days and who pays you within a week? So we're able to give you very good data insights using our smart analytics product that we shall be seeing later on. We're also able to tell you on how your users are using the smart system. Because if you have a user who enters diagnosis and they capture the first line, abnormal, the abnormal symptoms, because everybody here captures the first A, but you're giving somebody malaria medication, but you've really captured the wrong diagnosis. It happens, and we are suffering out of that because people are not keen on what they're entering, so the diagnosis is not marrying to the treatment that the patient is receiving. So we want to tell you who across your healthcare service provider is not doing the right thing, ama who is not finishing the visit, because what they always tell us is that patients from these schemes don't come back to run their fingerprint. So we want to tell you who is doing what across the system that they are using. So that is our value propositions, and we continue to be very, very innovative. We're going to show you what is coming up next on our offerings, and we have something very good in store for our healthcare service providers. So our products that we have for our healthcare service providers, of course, our core system, the MediSmart. You noted last year, we were able to do an upgrade, and it has a new look. See, there's a change with the smart system. So that was our initial solution that automated how scheme management is actually done across different payers. So we were also to have able to innovate our Smart Health Plus product, HMIS. This is a system that we have been running for the last 2 years. A lot of runnings that have gone into that system, because what we did is we listened to the pain points that you people go through when you're using your hospital system, and we were able to automate that. So we will be taking you through the capability of that system and what we're able to do. So we also have another product, the Smart Time Attendance and Access Control, because you want to know how are your staff coming, how are your employees reporting to work, who is doing what shift, how many hours did the doctor come. I know here we do not have those habits of where a doctor comes in, hangs the coat and leaves, because a lot of you are private healthcare service providers. But what we're able to do, so we're also able to automate the shift system, because I know hospitals have very many shifts. We've done this for key healthcare service provider like the Aga Khan Hospital, the Nairobi Hospital, who use our time and attendance to manage and automate their staff, employee management, and how the employee report to work. Our final product, not final product, the ones that we have now is on our smart analytics solution. It's a business intelligence tool that is able to give you medical insight so that you can be able to make data-driven informed decisions. So when we started off with this product, I know we worked generally with a few hospitals who are on an expansion strategy. And every hospital is actually expanding to one county or another. But what I always ask, what services why are you going to open a clinic in Kericho? Do you have information why you're going there? Or you just go there blindly? So what we do is actually, if you come and tell us, my expansion strategy for this year, I'm looking at opening 5 clinics. I want to put up an ICU, but why would you put up an ICU in a village where you may never get a patient and you've done a very huge investment on it? So what we do is we're able to guide you on the next best place to open your clinic, the best services that you can set up there, how do you cost those services, what diagnoses are prevailing in those areas, so that even when you probably bringing specialists, you don't take specialists in an area where probably that condition is not even there. So what we've done, we've walked the journey with a lot of our healthcare service providers, and we've guided them on their expansion strategy. We also do, of course, peer comparisons, but this is highly anonymized so that you know, how am I performing against my peer within the region? Because you know how you're performing as a provider, but how you're performing against your competition or your peers in the region. So really that is what we do. Of course, we have other upcoming innovations. We're going to do another upgrade. We have our new solution called Smart Connect that we shall be launching, and we're here to request for your support. It's going to change a bit of how you do your processes. We are actually now going to even change our MediSmart product to a new face, a new look and feel. We are going to empower hospitals more. We are going to allow you to be able to upload your catalog, because what we do is we want to take our services to the patient. So if I am Esther, I've come to Nakuru, I'm looking for a gynecologist. The app will be able to guide me on where to go next. So our request is that you actually work with us. Let us publish you out there, because we will give you visibility to the 1.7 million members who are out there. A lot of hospitals have been saying, I cannot wait to be on that platform, because I want, if they are searching for an optical shop, I want them to see me before they see my competition. So we have a very good thing coming up. We're also going into telemedicine, where our patients will be able to do online appointment booking. A patient will also be able to consult with doctors through our Smart Connect platform. We will see a bit of that in our upcoming presentations, but that is actually what we do for our hospitals. So we are not just the biometric people that you come and put the fingerprint. No, we have much, much more solutions that we have for our hospitals. Thank you so much for listening. Ian, where is Ian?
Please, let's appreciate Esther Macharia one more time with a round of applause. Thank you, Esther, for that fantastic presentation. There's so much value proposition that is being communicated from smart applications. And I know there's some of us who are here and they're wondering, is the smart application team on the ground, so that I can have a conversation with them? Please, let's have the smart applications team who are here. Let's all rise so that just for the sake of visibility also to our delegates who are here, I'll ask the Smart Applications team who are all over the room. I know some of the registration desk. We have a good representation that is there at the back. We have our senior management team that is here. I know we have our regional manager who is seated at the same table with our COO and also our group director for healthcare, Mr. Alex, but we'll do the proper introduction. So delegates, please let's appreciate them one more time with a round of applause. You may have your seats. During our tea break, these are the people that you need to pull aside and also have a more deeper, differentiated conversation. All right, fantastic. Ladies and gentlemen, we want to go to our next speaker who is going to guide us on the Smart Health Plus. And we're looking forward to this particular conversation. Our next speaker, ladies and gentlemen, is a sales manager focusing on Smart Health Plus, HMIS. And this is a man who comes with a wealth of experience, and he's able to boast around 12 years of experience at Smart Kenya, not only just Kenya, but also Uganda, servicing in various capacities. Ladies and gentlemen, help me appreciate our sales manager, Mr. Justin Mugi, as he comes forward to guide us on the Smart Health Plus, man who has a wealth of experience, not just in Kenya, but also in Uganda. Welcome, Justin. Glad to have you here.
Thank you very much, Ian. As we set up, good morning, everyone. Welcome to our event.
Check, great. Justin, if you can come to the side. I want to ask Mr. Justin a question, all right? like a true leader and a man who is focused on the number. Thank you, Mr. Justin. Let's appreciate him for helping us know him better. And the beauty about that is that now we can be able to appreciate his presentation even more. Welcome, Justin.
So thank you so much, Ian. And thank you so much, our delegates, for today. I really appreciate this opportunity to showcase to you our cutting-edge solution. It's called the Smart Health Plus Hospital Management Information System. This system is a web-based application that is internally developed at Smart, and it has a wide range of capabilities that we are going to see from our presentation. So apart from it being able to manage a healthcare facility, it comes with other capabilities where we can use functionalities like multi-tenancy to be able to manage or to centralize information. Let's say as a healthcare provider, you have a number of facilities that you're running and you'd want to centralize that. This system has that capability. It also has the capability to work online and offline. So when this system is working from your premises, it can make use of the local area network and you'll be able to access services. Again, when you want to access this system when you are remotely connected, you can also be able to do so using the web capabilities, and through the internet, you'll be able to access this system. So as we go through the various modules of the system, we will not go into detail. It's just a highlight of the capabilities that we have. We'll start with a dashboard. So the dashboard presents you with some bit of analytics. So we also have another product that is more comprehensive on analytics, but even with this system, you can be able to do analytics. So on this analytics, you'll be able to see operation-wise how many patients you've are actively visiting the facility. You'll also be able to see how many are new patients, how many are revisits, and you'll also be able to tell the locations. This is where your patients are coming from. Remember, when you register patients, there's a capability that helps you to record where they are coming, where the patients are coming from, the various sub-counties, the counties, depending on how you want to classify it. Then you'll also be able to see patients with active appointments, if you've already set the appointments, as we are going to see on the system, and the active patients on the queue. So under clinical, the system is able to track the diagnosis. It already has the ICD-11 on board. So you'll be able to access an analysis of the diagnoses that have been entered by the doctors against the age brackets. So you're able to tell which one is the most common diagnosis and who is being affected by that diagnosis. That way, you're able to plan and you're able to strategize. Then you're also able to see the visits by gender. You also be able to see the visit by the type of visit and the status of those visits, patients who check in, who have checked out, who have been discharged. Then you're also able to see the doctor's request and the request by status. So it's one thing for a doctor to request for a patient to do a lab test, but how often does that get fulfilled? So the system is able to tell you whether that request has been fulfilled or not. Then you're also able to see the patients by clinic. So you'll be able to configure the various clinics, and you can be able to monitor the patients that are registered for those clinics. And then you can also be able to do referrals. So the system will be able to help you with the referrals. So when you have a number of facilities and maybe you want to refer, you have a main hospital and then you have the satellite clinics, you can do referrals from those hospitals, the main facility, but also you can do internal referrals, whereby you're referring to an internal specialist. Let's say you have a pediatrician on board, you can actually refer to the pediatrician. You can also be able to see the request per doctor and patient by doctor. So when a doctor makes a request to lab, pharmacy, procedure, you're able to see how many requests have been made and how many patients a particular doctor has seen. Then you're also able to see the commonly dispensed drugs, so you can actually be able to filter, and you can actually try to relate the dispensing of drugs and the diagnosis. More often than not, it should be able to rhyme. Then under stock and inventory, in real time, you'll be able to track your stock. You can tell how your stock is moving. So as the dispensing is happening, the stock will be able to decrease. As you receive stock, you'll be able to also update the stock. Then you also be able to see the stock values, how much you're holding in form of the money you have in form of your stock. Then under financials, as you do your collections, you'll be able to see the debtors. You're also able to see what you've received and what you're owed. And then you can also see the status of the bills, what has been billed, what has been refunded. You're also able to see the payers and how much they owe you. So you'll be able to tell how much you're owed by various payers and the status of those invoices. Of course, the invoice goes through various phases before it gets to the payment. So you'll be able to see the status. If it's overdue, definitely you're able to set the payment periods depending on the agreement between yourselves and the payers, and you'll be able to track those payment periods. Then under creditors, you're able to see how much you owe. These are your suppliers for drugs, suppliers for services, and then you're also able to see the credit invoice status, what you paid and what you've not paid. Then daily collections, you can see in real time the daily collections, and then collections per cashier. So you're able to configure all your cashiers and you'll be able to monitor how much they have collected. And then you're also able to see the collections per payment method, then and collections per product category, whichever product that you've been able to come up with. So collections per product per payment method, you can employ the various methods of payment. We also have integrated this to the like M-Pesa platform for payment. So that will make it easier and seamless. Then when you go into the various modules, I'll just highlight what we have. Under patient management, you can be able to register your patients. You can view the patient register. You can register a new patient. But on top of that, we have introduced the capability of a fingerprint. The reason being, hospitals are struggling a lot with maintaining unique records for patients. So you'll find that today I'll come to your facility, I give you my first name and maybe my surname. Then the next time I visit, I'll give you my middle name and my surname. And sometimes you are not able to tell whether this is the same person. Yet there's a requirement in the industry to maintain a unique file for the patient. So you can register the patient fingerprints to be able to uniquely identify them. You also be able to register new patients. Under registration of new patients, you can enter the residence so that you're able to track where they're coming from, and you're also able to see the various capabilities like the date of birth so that it can calculate for you the age. Then under queue, you're able to manage the queues of the patient. You're able to see which patient is in which queue. So, and then the queue is able to create for you a patient journey. When I move from triage to consultation, the system will be able to track that for you. And it will also be able to tell you the turnaround time of that particular patient so that you can monitor and tell how long you're taking with your patients. The appointments, you can be able to set appointments. You'll be able to view the existing appointments. And if you want to cancel or reschedule appointments, you can be able to do it from here. So it will give you a calendar view. You can filter as per the doctor who has appointments for that day or the patients. Then under appointments, there's an integration to the SMS capability in the sense that you are able to send reminders, automated reminders to the patients for appointments. Then under Gate Pass, of course, mostly for inpatient facilities, when you check out the patient or you discharge, you can be able to generate a gate pass for those patients. Then under merge patient records, the system is able to merge patient records. Remember, I mentioned about the challenge with maintaining a unique file for the patient. If you realize that there's this patient who has more than one file, you can be able to actually merge those files and maintain one single record. Other capabilities are like the triage, where you're able to monitor and take the vitals. You'll be able to see the history of the vitals. You're also able to see the payment method. If they're using insurance, you'll also be able to see how much is the limit. So the system is able to keep for you the running limit, meaning that if I came in with the 10,000 on my card, as I access the services, the system is able to track and tell you this is how much is remaining at every point of service. So that at the point where you're concluding with that bill, you will not have a challenge with a patient who has exhausted the cover. So under consultation, you're able to manage consultation, you can do observations, you can be able to do the diagnosis, you're able to also do prescriptions, requests, you can handle requests, you can get the lab results, and then you can also monitor consumables. So sometimes a patient will go to the doctor, and maybe there are some certain consumables the doctor will use when interacting with that patient. For example, the gloves. How do you even account for such consumables? So that's why we have introduced the capability for consumables, so that whenever you issue gloves to the doctors, or whichever consumables that they'll use in their room, you can be able to account for them. Then under disposition, the doctor is able to send, to set an appointment. Appointment can be done either at the registration desk or at the doctor's side. Then admissions, you will be able to handle the admissions and also requests for theater. The doctor can make a request for admission and can also make a request to the theater. And of course, you can be able to generate the sick-offs for those patients. So apart from that, the doctor can be able to monitor the appointments. They can see the number of patients they've seen. The sick sheets can be done from there. So the system also has nursing, where you're able to manage procedures, lab, where you're also able to manage lab requests. You can also have requests that are coming from the doctor, requests that go directly to the lab. So you're able to handle things like walk-in. And another capability that is on the lab, you're able to monitor the reagents. So you can configure the reagents and you can tell how much of a reagent has been used. And then you're also able to send alerts to patients. For example, if I decide to come to your lab and do a test, and then I go back to work, maybe I did that during lunchtime, you can send me an alert when that test is ready so that I can come back for the results. Then it's also able to do for you a countdown. So for every lab test, you know the estimated time that you take to be able to do that test. So the system gives you a countdown up to the point where you're supposed now to release those results. That is also in trying to make sure that you manage the TAT for the patient. So you're also able to do dispensing of drugs. So the requests that come from the doctor and also direct requests at the pharmacy can be handled. And of course, under insurance patients, you can also be able to handle exclusions, both even for the pharmacy and the other departments. For example, if there is a certain drug that I'm not supposed to get through my cover, you can exclude it. So you can do it from a global level where you configure all the exclusions, or at the point where you're dispensing, you can set an exclusion. Then, of course, the radiology has a similar logic. You can upload the templates, and then through the templates, you'll be able to handle the scans and, of course, the reporting of the scans. Then the system has other specialized modules like the optical. You can manage consultations under optical, the request, the sales for optical. So, and of course, even the pre-auth, you'll be able to handle it from here. And of course, another key capability is the treatment plan. Treatment plan applies for those services that take more than one visit. For example, if I come for a root canal, it will not be done on that same day. There'll be a number of visits that will be done. So you can set a treatment plan so that the system is able to show you what has been, how many sessions I've attended, how many I have not yet attended, how many have been paid for. So you're able to track the treatment plan. This is not only for the dental, it applies even for services like physio, cancer care, renal. If I'm coming for dialysis, I'll be able to handle that. Then under inpatient, the system is able to handle for you the inpatient. You'll be able to admit the patient. You'll be able to do the triaging. You'll be able to do the nursing at the inpatient, where the nurses will be able to do the notes, the doctor's notes. All those capabilities will be handled under inpatient. And then under ward management, discharges, you can be able to process a discharge. As you process the discharge, you can even, if you have a morgue, you can admit in the morgue. And of course, you can also do reverse discharge. For example, if I've been discharged and for some reason I need to go back to the ward, you don't have to admit again. You can do a reverse discharge for that particular patient, and then they'll go back to that particular, maybe they can be assigned a different bed. So those are some of the capabilities. Then you can also do the charges. You can do, if you're doing a daily charge, there are those services and the inpatient that you'll be able to do to have the daily charges. So the system will bill those services automatically. If, for example, in your case, you are doing an hourly charge, you can be able to do so. Again, the system, you can also be able to change the prices as per the time. For example, if you have a different price when a patient comes beyond certain hours, you can set that on the system. If also you charge differently during public holidays, you can also set it on the system in a way that when it is a public holiday, then the prices can change. As much as, yes, you will be able to maintain unique price books for depending on who you are serving. So you can have over the various price books set up on the system. So you'll be able to manage your wards, your rooms, and of course the pricing for the same can be managed. You can do ambulance management, you can set your ambulance, you can handle dispatches. Morgue management, you'll be able to handle the aspects of the morgue, and of course you will be able to admit in the morgue, you'll be able to discharge, and of course you can set up the various capabilities in the morgue. Under billing, the system is able to handle the patient bills. You'll be able to see the mode of billing, whether it's insurance or cash. And of course, the prices will apply depending on your price book. You'll be able to do the billing. There is an integration to eTeams for this particular system. There is an integration to M-Pesa. And of course, you can be able to do cash bills, mobile money, bank, card, and even an e-wallet. E-wallet is where a patient decides to save some money with you, and then they are able to access services. When they need to access services, of course, you can make use of the e-wallet. This can also happen by a patient depositing to the e-wallet. Let's say under inpatient, there is a deposit that is done. So it doesn't only apply for inpatient, it applies across board. And of course, the e-wallet can also be accessed by the kins of that particular patient. So if, let's say, I have my family and we have a wallet within your hospital, then we can be able to access those services. So you'll also be able to monitor bill adjustments. Sometimes hospitals do bill adjustment for various reasons, especially when you're, for a lot of bills, including inpatient happens a lot. So you also be able to do the invoicing. So under invoicing, the capabilities that are on this system is that you can invoice more than one payer. So an invoice will come through and a patient has more than one payer to pay for that bill. So you can invoice as per the line items, or else you can do it as a block figure. Let's say one insurance has said they are paying 50,000 and the other one 100,000. So those two are also catered for. Then you're also able to see the history of billing. You can see the history of receipts and invoices, and you can be able to actually do reversals from here. Then the system will also help you to manage your assets. These are now the back office operations. You can monitor your assets. You can set the depreciation and appreciation. Then you can also handle aspects of accounting, where you'll be able to do the chart of accounts, the journal entries. You can generate the journal. You'll also be able to do the banking, and of course, expenses and bills. You can be able to monitor your expenses. You can handle payments and also receipts. This is where now you receive. You've been paid by an insurance. You'll be able to receive. And the system also helps you to do auto-reconciliation and claims management, which I'll also talk about as I move forward. Of course, there's the aspect of shift management. You'll be able to manage cashier shifts, and you'll also be able to do the settlements. In case someone has a shortage or an excess, you can be able to handle the settlements. Petty cash, you handle the request, the approvals, and the payment. Of course, you will also be able to deposit to that petty cash account. Then under budget management, if there are certain aspects of the budget that you need to handle from the system, you'll be able to set them up, and of course, you'll be able to handle the budget invoices. It also has a HR capability. The HR module is able to help you manage the payroll, the leave management. We've also gone ahead now to integrate to the time and attendance system. I think Esther alluded to the time and attendance system, where people can clock in and will be able to monitor their overtimes and such. So there are also other capabilities on the HR that we are building right now, so that we can make it as comprehensive as possible. Then under stock and inventory, you're able to handle your suppliers. You can be able to do requisition, the purchase orders. You're also able to do the purchase receive, the stock stock transfer from one store to another, the approvals that come with that will also be able to be handled, the returns to the suppliers, and then the supplier management, you'll be able to handle your suppliers. And again, the other suppliers that are not necessarily stock item suppliers. There are suppliers like, for example, someone providing certain services, you'll be able to handle them from here, and you'll also be able to settle those invoices. Then under claims management, you'll be able to monitor your invoices, you can handle open invoices, you can amend an invoice, you can be able to merge invoices. Allocation of receipts is what I had said earlier, where you want to allocate the whatever has been paid by the insurance. So you can upload that particular payment schedule, and then the system will be able to do the allocation for you, other than doing it manually. Then you're also able to handle, to import external data. So we are able to import external data. If you already have an existing system and that data needs to be migrated to the new system, you'll be able to do that. Then under administration, you're able to handle the users and roles. So how we handle it on our system, you are able to create the various roles. Let's say there's a role called lab tech. There's a role called nurse. So anyone who has that responsibility will be automatically assigned the rights that are within that particular role. Meaning that when they open their system, they will not be able to see what we are seeing here. They'll only be able to see what pertains their role. So that is on role management. And again, you're also able to make certain configurations, like if you want to do password expiries, you want password to expire after 10 days, how long does the system take to lock? Let's say when I leave my screen open, the system can lock. So the system administrator can be able to do those configurations to ensure that you enhance security of the system. And the organization, you're able to set up the organization. And of course, the aspects of multi-tenancy, if you want to add other clinics on the system, of course, we'll be able to activate for you a license for the same. And then product and services, you're able to upload all your items, your services and the prices, and of course, secondary pricing. Because the system is able to handle multi-pricing, you can charge the same service differently to a wide range of people. And then, of course, you will be able to upload your logo. So all the documents that are generated by this system will come with your logo. And of course, notifications. I've alluded to some of the notifications, but there are others, like broadcast messages. You can be able to send, if you want to send a communication to all your patients, to all your suppliers, or any category that you may want to send a communication to, you're able to handle that. And of course, you set the message and you set the time when you want that message to go out. Then you're also able to set automated notifications, for example, things like reorder levels. You don't want to find yourself in a situation where a certain item is done, and by the time now you're ordering, you already don't have it in stock. Then also you have other things like bulk emails. You are able to handle bulk emails. Of course, there are also automated notifications for things like expiries. You'll be able to do the expiries. You're also able to do broadcast emails. If you want to send to all your employees, to patients who visited on a particular date, you can decide what notifications you want to send. Then the system has a reporting module, which will give you the business overview reports, the patient reports, inventory reports. You're able to handle anything to do with stock adjustment, stock take. And just to mention under stock take, there is a capability on this system whereby you can actually pause the stock. When you're doing the stock take, you pause the stock. Of course, it doesn't mean that you stop dispensing, you continue dispensing. But after you're done with the stock take and you upload the new stock, the system will also balance out with what had already been dispensed from the time that you post that stock. So it helps you to be able to have accuracy in management of your stock. Then, you're able to handle the stock purchase, the evaluations, of course, consumables. You're able to get the reporting, as I mentioned. At every point of service, you're able to handle consumables. Whether it's nursing, the syringes that are used, various points of service, there is stock items that are used. Payment and purchases, claims management, MOH, you're able to generate the reports, and of course there is a daily report. So basically, that's an overview of the system that we have. It's called the Smart Health Plus Hospital Management Information System. To get this system, you're able to be able to get you a perpetual license or a subscription model, depending on what is what you would want. So, and again, the system can work for a big facility. As Esther mentioned, there is already a level 5 facility that has onboarded this system. And of course, in small facilities, the clinics. So we have various packages. We have the Smart Health Light, we have the Silver, we have the Gold, and a Platinum. Light applies for maybe you have a doctor's practice, you have a Silver, which is maybe an outpatient center with lab and a pharmacy. Then we have Gold, where you have an inpatient, and of course the Platinum is where you have a level 4, level 5 facility, or level 6. So basically, that's the system. We have, maybe just to mention, there are a number of facilities that are using this system here in this region. And just to mention a few of them, we have Nakuru Specialist that is using this system. We have the St. Joseph's Moro that is using this system. We have also War Memorial was using our system. And recently, we are in the process of implementing at AIC Litain, which is a level 5 hospital. Those are just a few of the facilities. And again, as far as Rumuruti and Marral, we have clients there. We have Glofen in Marral. Of course, we can go anywhere, including West Pokot. We have a facility called Amakuriat. So feel free. And again, as it was mentioned, we're able to provide you support. So this is what we've done for a very long time for our MediSmart system, which you've used. It's the same platform for support will be used to support this particular system. So feel free to reach out to us. We can be able to do a specialized demo, and I really appreciate your time, and thank you for listening. Thank you so much.
Thank you, Justin. Before we let Justin go, we just want to see if there's any question on the floor in regards to his presentation. Just raise up your hand and then we'll bring the mic to you. If you have any question that you would like to ask in regards to his presentation, please just raise up your hand and we'll bring the mic to you. I don't see any question being popped up. We want to make sure that if we can, let me see if I can get to him. We're trying as much as possible to make sure that our engagement is going to be there, especially with the delegates. So if you have the question, you'll tell us your name, where you're from, and then you can throw it.
Thank you very much for the presentation. The system sounds, I'm Benjamin Tanoi from Nakuru County here. I've also worked with systems for several years. However, we have a challenge for the inpatient, because we have had vendors coming in and out claiming that they can, the system can work for the inpatient, but practically we have not seen it. So as you've said, it is also good to maybe for those members who will be interested like us, might want to see it practically where it has been working, especially for the inpatient. Because systems have been coming, but I've seen them just working for the outpatient. But for the inpatient, we have not had one. And that's where the interest is. I know systems work very well in OPD. They work very well in collecting the revenues for the facilities. But for the inpatient, we still remain with papers and patient files. Thank you.
Thank you for that. Justin, you'd like to take it up? All right, well, just it's one question so that now we see if we can combine the two questions. We'll take at most two in the interest of time so that now we can take a small health break. I'd like to know your good name and where you're from.
I'm Jambo. I am Felista Wamboi from Marara, the Glofem Clinic. We are using the system. Okay, I was asking about the check-outing the patient whenever the patient comes in. We used to check out before we register for he or she to see the doctor. I was asking, is it possible for check-outing thing before 24 hours? Is it possible for the system to be updated? Instead of us checking out the patient, it just check out automatically within 24 hours. And again, the dispensing of the drugs, instead of us dispensing the drug, can it be possible for the drug to be just whenever I have given the drug to the client after 24 hours, is it possible for the drug to be just dispense, it dispense just automatically instead of us going back again to dispense the drug.
All right, you can go for it, Justin.
Thank you so much for those questions. Yes, I agree with Mr. Tonui, seated behind there. So yes, there's usually a challenge sometimes in implementation of inpatient, but there's also, if I may answer that question, it cuts in two ways. One, the inpatient process within the hospital, sometimes there's some level of reluctance also to be able to deploy the system on inpatient, because for inpatient, you also require that the users are actively using the system. If you talk of a doctor moving around to be able to see the patient, they need to actively enter those notes. Else, if they don't enter the notes, there is a desk where maybe the nurse within that ward is able to handle that. But we can be able to demonstrate for you how our inpatient is able to work. It's working for a number of facilities. Of course, the inpatient facilities that are using this system are able to use this particular system. And of course, if just I can mention, we can take you to some of the facilities where they are using, and you can see how they are doing the process of the inpatient. But yes, there's a challenge sometimes, but also it also has to do with the processes, with the, yes, as much as some systems may fail, there's also a challenge with the process within the hospital to make sure that it's able to align properly for the system to fully work within the inpatient department. But yes, the capabilities are there from discharge, from ward management, the daily notes that are supposed to be done, the doctor's instructions. For example, if a doctor said these patients need to be taken out in the sun once a day, you can be able to confirm that that has been done. Then you can also be able to also do the dispensing within, or the prescriptions within the inpatient. I know there's a file you maintain called, I think, the treatment sheet. That treatment sheet is available next to the patient. So the same thing has been provided for on the system in a way that when the doctor is prescribed the drugs for inpatient, the system automatically creates the treatment sheet. We call it the treatment schedule on our system, such that when whoever is dispensing those drugs, when they confirm that they have done the dispensing, the system is able to confirm the time, and if the dispensing has not been done, it can show you what is pending. Those are some of the capabilities that are there on the system, but yes, we can be able to demo for you, and we can also be able to take you to one of the facilities that is using it. Coming to Glofen, yes, you can be able to do the checkouts on the system automatically. After 24 hours, you just go to the settings and you're able to configure that. We can be able to work with our support officer within that side to be able to assist you with that. The system can either do auto checkouts, and it can also be able to, you can manually check out the patient. So that is handled on the system. I think it's just a matter of helping you to handle that.
Fantastic. The thing I like about Justin is how well versed he is. I know because of the interest of time, I can see the questions are really coming up. We will just hold it up to that. We'll try and see how we can also continue with the engagement. But thank you for that, Justin, for such a seasoned sales manager that we have here at Smart Application. Let's appreciate him with a round of applause for that presentation. Justin, I'd also like to give you another honor to present a gift. I have a trivia question that I'd like to ask the delegates. And for the one who's going to get it correctly, there's a gift package courtesy of one of our partners, Hako Industries, that is right here. Now, I'll ask a question. If you believe that you know the answer, the first hand that goes up will get the opportunity to answer. And if you have it correctly, this is your gift package. You go for tea break with a gift, isn't it? Now, what does the following abbreviation stand for in medical imaging? MRI. Gentleman there? Yes, correct. Let's appreciate him as he comes. Come forward, come forward. Congratulations, congratulations, congratulations. Tell them again the answer for MRI.
Magnetic resonance imaging.
All right, fantastic. And also just please, now these are your subordinates, all right? Please tell us, how does it feel to be a winner? Address your subordinates, tell us.
Thank you so much. My name is Dr. Silas Lodeke from Maralal Community Clinic. I feel happy and appreciated. Thank you.
Thank you. Let's appreciate Daktari. You heard Daktari mukasema kimeibiwa. Please, did we get the photo correctly? All right. Let's appreciate Daktari one more time as we also appreciate Justin. Thank you very much. We appreciate that fantastic presentation. We would like to take our break. I just want to advise you that we have the washrooms at the far end on my extreme left. That's where the washrooms are. And then the serving stations for the break is going to be right over here. Please, we want to also update you that we are taking photos even as we proceed with this session. If you have a certain disclaimer that you wouldn't want your photo taken, please just let us know at the registration desk, and then we'll see how to best serve you. All right. It is exactly 11 o'clock. We want to be here back at exactly 11:30. Please give a high five to the person seated next to you and tell them tea is on Esther Macharia. Fantastic. Thank you. Enjoy your cup of tea and the snacks right over there. And also use this opportunity to engage with the Smart Applications team. But wait again, just hold on. Ladies and gentlemen, before we break for tea, I just want to do a certain recognition, especially for our guests who are here. Let me see by a show of hands, how many of us are from Baringo County here? Baringo County, please rise from Baringo County. Delegates, let's appreciate our delegates from Baringo County. All right, how many of us are from Laikipia? Any of us from Laikipia here? Please, let's appreciate our delegates from Laikipia. All right, fantastic. How many of us are from Bomet? How many of us are from Bomet? Do we have delegates from Bomet? Yes, right here. Let's appreciate them. Glad to have the lady here. How many of us from Kericho? All the way from Kericho. Yes, at the far end. Let's appreciate them. How many of us from Nakuru? Nakuru is home. How many of us from Simameni atakanisi wote, all right? Okay, let's appreciate our delegates from Nakuru. All right. How many of us from Narok County? All right, fantastic. None from Narok County. How many of us from Trans Nzoia? Yes, let's appreciate them from Trans Nzoia. How many of us from Uasin Gishu? Let us see. Yes, makofi tafadhali. And how many of us from West Pokot at the far end? We have you. Let's appreciate them. How many of us from Elgeyo Marakwet? Simama tafadhali tukuone. Let's appreciate her from Elgeyo. How many of us from Nandi County? Makofi tafadhali. And then how many of us are from Samburu? Any of us from Samburu? Yes, Daktari, I see you. Gentlemen at the far end. Also, how many of us from Kajiado? Kajiado do we have? All right. And finally, how many of us are from Turkana? Okay. I hope, is there anyone that we have missed out? We have covered most of that. Please appreciate yourselves with a round of applause. Once again, we want to now break off for tea. Please give a high five once again to the person seated next to you and tell them, I need to get to know you with Smart Application, all right? Enjoy your cup of tea. Let's all circle back here at exactly 11:30. Karibuni sana. Welcome.
Sometimes you be like say, nobody's in you, that's when I did.
Are you a hospital owner, medical entrepreneur, medical consultant, or practitioner tired of the hassles that come with managing your healthcare facility? Introducing Smart Health Plus, the revolutionary solution that elevates your patient care, billing, and boosts your facility's productivity. With Smart Health Plus, you can digitally transform your healthcare facility a click at a time. Smart Health Plus benefits include ease of use, scalability and interoperability, enhanced patient care and engagement, inventory and supply chain management, enhanced security and privacy, streamlined reporting and compliance, data centralization and analysis, finance and accounts management. To learn more about Smart Health Plus, you can talk to us on email at providersadmin@smartapplicationsgroup.com. Smart Health Plus, the HMIS of choice. Are you a hospital owner, medical entrepreneur, medical consultant, or practitioner tired of the hassles that come with managing your healthcare facility? Introducing Smart Health Plus, the revolutionary solution that elevates your patient care, billing, and boosts your facility's productivity. With Smart Health Plus, you can digitally transform your healthcare facility a click at a time. Smart Health Plus benefits include ease of use, scalability and interoperability, enhanced patient care and engagement, inventory and supply chain management, enhanced security and privacy, streamlined reporting and compliance, data centralization and analysis, finance and accounts management. To learn more about Smart Health Plus, you can talk to us on email at providersadmin@smartapplicationsgroup.com. Smart Health Plus, the HMIS of choice.
Introducing Smart Access, the customer virtual access to healthcare. The app that does everything your medical insurance card does and much, much more. To download, go to the Google Play Store or Apple Store and download the Smart Access app. Once downloaded, register by creating a username and providing your telephone number or email address. A generated OTP will be sent to your phone or email address for input. Once you input this OTP, you can now proceed to use the app securely. Additionally, you can tag the app to your phone, meaning the app can only be used by that particular device and cannot be accessed on any other device. This is an additional security feature to safeguard access to your medical covers. The Smart Access app will enable you to get all your 1. Covers in one place. You can see your covers both inpatient or outpatient, and the same for all your dependents. The covers will be listed on the app and you can click on each to see the balances available. 2. Medical cover balances. On the app, you will be able to see the updated balances for each cover. This will be updated in real time and you can see your cover utilization. 3. Customer statements. On the app, you can request to see your last 10 transactions or even a full statement of utilization that can be sent to you on email. 4. Virtual medical card. The app will have your virtual medical card and you can initiate a hospital visit for you or someone else who is a dependent without physically being present at the hospital. To initiate a hospital visit, within the submenu titled My Cover, you click to Initiate Hospital Visit. It will give the code on screen and then send an SMS on the same. This is the code that will then be given to the cashier at the hospital as authorization for the hospital visit. 5. Mapped out doctors, hospitals, and other healthcare facilities. On the app, you can see different medical providers by location, specialty, or even accessibility under your insurance cover. 6. Health stories on the go. You can pick your health topics of interest and can see different stories curated just for you. All these features and a lot more are available on the Smart Access app. Download it today and have full control of your health cover. Available on the Google Play and Apple App Store. Introducing Smart Access, the customer virtual access to healthcare. The app that does everything your medical insurance card does and much, much more. To download, go to the Google Play Store or Apple Store and download the Smart Access app. Once downloaded, register by creating a username and providing your telephone number or email address. A generated OTP will be sent to your phone or email address for input. Once you input this OTP, you can now proceed to use the app securely. Additionally, you can tag the app to your phone, meaning the app can only be used by that particular device and cannot be accessed on any other device. This is an additional security feature to safeguard access to your medical covers. The Smart Access app will enable you to get all your 1. Covers in one place. You can see your covers both inpatient or outpatient, and the same for all your dependents. The covers will be listed on the app and you can click on each to see the balances available. 2. Medical cover balances. On the app, you will be able to see the updated balances for each cover. This will be updated in real time and you can see your cover utilization. 3. Customer statements. On the app, you can request to see your last 10 transactions or even a full statement of utilization that can be sent to you on email. 4. Virtual medical card. The app will have your virtual medical card and you can initiate a hospital visit for you or someone else who is a dependent without physically being present at the hospital. To initiate a hospital visit, within the submenu titled My Cover, you click to Initiate Hospital Visit. It will give the code on screen and then send an SMS on the same. This is the code that will then be given to the cashier at the hospital as authorization for the hospital visit. 5. Mapped out doctors, hospitals, and other healthcare facilities. On the app, you can see different medical providers by location, specialty, or even accessibility under your insurance cover. 6. Health stories on the go. You can pick your health topics of interest and can see different stories curated just for you. All these features and a lot more are available on the Smart Access app. Download it today and have full control of your health cover. Available on the Google Play and Apple App Store.
Are you a hospital owner, medical entrepreneur, medical consultant, or practitioner tired of the hassles that come with managing your healthcare facility? Introducing Smart Health Plus, the revolutionary solution that elevates your patient care, billing, and boosts your facility's productivity. With Smart Health Plus, you can digitally transform your healthcare facility a click at a time. Smart Health Plus benefits include ease of use, scalability and interoperability, enhanced patient care and engagement, inventory and supply chain management, enhanced security and privacy, streamlined reporting and compliance, data centralization and analysis, finance and accounts management. To learn more about Smart Health Plus, you can talk to us on email at providersadmin@smartapplicationsgroup.com. Smart Health Plus, the HMIS of choice. Are you a hospital owner, medical entrepreneur, medical consultant, or practitioner tired of the hassles that come with managing your healthcare facility? Introducing Smart Health Plus, the revolutionary solution that elevates your patient care, billing, and boosts your facility's productivity. With Smart Health Plus, you can digitally transform your healthcare facility a click at a time. Smart Health Plus benefits include ease of use, scalability and interoperability, enhanced patient care and engagement, inventory and supply chain management, enhanced security and privacy, streamlined reporting and compliance, data centralization and analysis, finance and accounts management. To learn more about Smart Health Plus, you can talk to us on email at providersadmin@smartapplicationsgroup.com. Smart Health Plus, the HMIS of choice. Are you a hospital owner, medical entrepreneur, medical consultant, or practitioner tired of the hassles that come with managing your healthcare facility? Introducing Smart Health Plus, the revolutionary solution that elevates your patient care, billing, and boosts your facility's productivity. With Smart Health Plus, you can digitally transform your healthcare facility a click at a time. Smart Health Plus benefits include ease of use, scalability and interoperability, enhanced patient care and engagement, inventory and supply chain management, enhanced security and privacy, streamlined reporting and compliance, data centralization and analysis, finance and accounts management. To learn more about Smart Health Plus, you can talk to us on email at providersadmin@smartapplicationsgroup.com. Smart Health Plus, the HMIS of choice. Are you a hospital owner, medical entrepreneur, medical consultant, or practitioner tired of the hassles that come with managing your healthcare facility? Introducing Smart Health Plus, the revolutionary solution that elevates your patient care, billing, and boosts your facility's productivity. With Smart Health Plus, you can digitally transform your healthcare facility a click at a time. Smart Health Plus benefits include ease of use, scalability and interoperability, enhanced patient care and engagement, inventory and supply chain management, enhanced security and privacy, streamlined reporting and compliance, data centralization and analysis, finance and accounts management. To learn more about Smart Health Plus, you can talk to us on email at providersadmin@smartapplicationsgroup.com. Smart Health Plus, the HMIS of choice.
Introducing Smart Access, the customer virtual access to healthcare. The app that does everything your medical insurance card does and much, much more. To download, go to the Google Play Store or Apple Store and download the Smart Access app. Once downloaded, register by creating a username and providing your telephone number or email address. A generated OTP will be sent to your phone or email address for input. Once you input this OTP, you can now proceed to use the app securely. Additionally, you can tag the app to your phone, meaning the app can only be used by that particular device and cannot be accessed on any other device. This is an additional security feature to safeguard access to your medical covers. The Smart Access app will enable you to get all your 1. Covers in one place. You can see your covers both inpatient or outpatient, and the same for all your dependents. The covers will be listed on the app and you can click on each to see the balances available. 2. Medical cover balances. On the app, you will be able to see the updated balances for each cover. This will be updated in real time and you can see your cover utilization. 3. Customer statements. On the app, you can request to see your last 10 transactions or even a full statement of utilization that can be sent to you on email. 4. Virtual medical card. The app will have your virtual medical card and you can initiate a hospital visit for you or someone else who is a dependent without physically being present at the hospital. To initiate a hospital visit, within the submenu titled My Cover, you click to Initiate Hospital Visit. It will give the code on screen and then send an SMS on the same. This is the code that will then be given to the cashier at the hospital as authorization for the hospital visit. 5. Mapped out doctors, hospitals, and other healthcare facilities. On the app, you can see different medical providers by location, specialty, or even accessibility under your insurance cover. 6. Health stories on the go. You can pick your health topics of interest and can see different stories curated just for you. All these features and a lot more are available on the Smart Access app. Download it today and have full control of your health cover. Available on the Google Play and Apple App Store. Introducing Smart Access, the customer virtual access to healthcare. The app that does everything your medical insurance card does and much, much more. To download, go to the Google Play Store or Apple Store and download the Smart Access app. Once downloaded, register by creating a username and providing your telephone number or email address. A generated OTP will be sent to your phone or email address for input. Once you input this OTP, you can now proceed to use the app securely. Additionally, you can tag the app to your phone, meaning the app can only be used by that particular device and cannot be accessed on any other device. This is an additional security feature to safeguard access to your medical covers. The Smart Access app will enable you to get all your 1. Covers in one place. You can see your covers both inpatient or outpatient and the same for all your dependents. The covers will be listed on the app and you can click on each to see the balances available. 2. Medical cover balances. On the app, you will be able to see the updated balances for each cover. This will be updated in real time and you can see your cover utilization. 3. Customer statements. On the app, you can request to see your last 10 transactions or even a full statement of utilization that can be sent to you on email. 4. Virtual medical card. The app will have your virtual medical card and you can initiate a hospital visit for you or someone else who is a dependent without physically being present at the hospital. To initiate a hospital visit, within the submenu titled My Cover, you click to Initiate Hospital Visit. It will give the code on screen and then send an SMS on the same. This is the code that will then be given to the cashier at the hospital as authorization for the hospital visit. 5. Mapped out doctors, hospitals, and other healthcare facilities. On the app, you can see different medical providers by location, specialty, or even accessibility under your insurance cover. 6. Health stories on the go. You can pick your health topics of interest and can see different stories curated just for you. All these features and a lot more are available on the Smart Access app. Download it today and have full control of your health cover. Available on the Google Play and Apple App Store.
My name is Lydia Masharia. I'm the Director in charge of Employee Benefits Insurances at Minet. That is where we take care of your employees' group life and pension. We take care of their health benefits. We also take care of actuarial services so that we can advise you better on the cost of the solutions that we give you. Minet Kenya is a one-stop shop for all insurances. So we also have our Minet Risk Solutions. We also have our retail and SME practice, and our vision is to secure your tomorrow. Smart Applications International, I think, was first introduced to me somewhere around 2004, 2005. By that time, I had been in Minet for maybe 6 years, about 6 years. And of course, since then till now, we have been interacting with the smart applications. And they came in with a solution that had not been heard about in the market, talking to us about being able to biometrically identify people and to be able to manage benefits remotely, and the member being able to see their balances and being able to know what products they are covered for by just accessing services at the provider's side. So we've known Smart for most of those 20 years, so to speak. Smart Applications has met our needs as an organization. As I said, we met in about 2005 when they first introduced the solution. At the time, the market was photocard driven. So for us to identify members, first of all, they needed to fill application forms. They needed to bring us photos so that we have a photo card that they can then go and use at the providers. One of the things that was a real clincher for this new solution was that they were offering us a solution that would enable us to manage fraud. Of course, we know that fraud is a big deal in medical. So when they did come and they did give us not only biometrics and management of benefit, they also gave us an ability to catch fraud, which was quite rampant with the photo cards because you couldn't quite tell whether this was the person, not the person. The card could be given to a cousin or to a friend. And so their solution seemed to be more holistic and was going to answer some of the problems that we were suffering as an industry at the time. Of course, as with any new thing, there were things that Smart brought along that we cannot forget. One of the things was that now for us to move onto this platform or to move our clients onto this platform, there would be a drastic change in cost from photo cards to smart cards. But there was also the element of the fact that there needed to be biometric card readers at the hospital. What I remember at the time is that not only were we now going to tell our clients that they needed to pay more for this identification solution, but we also needed to fund the putting of these biometric readers in the hospitals. That became a challenge. It became a big challenge for us because it meant this cost would then again also need to be passed back to the client. I think it was about 5,000 per reader. We have almost 1,000 facilities on our panel. So that became a challenge. But what is memorable to me about that is as soon as we made Smart understand the difficulty we were facing with trying to sell not only a more expensive card, but also to sell putting biometric readers in the hospital, they were able to go back to the drawing board and they were able to absorb the cost of readers in the provider facilities, and they quickly engaged most of the providers to try and have this solution put on. Of course, there was a lot of providers who, even as we see in change today, were a bit resistant. But there were those who were quick to embrace, like the Aga Khans were quick to embrace, Gertrude was quick to embrace, Mater Hospital was quick to embrace. I remember there was Acacia Clinics by the time, but now obviously Smart is already a well-known brand across all our hospital networks. That is one of the things that I would say is one of the memorable experiences, that together we were able to navigate those challenges and to get the providers to accept and to also get the clients to see the value of what was being done. Another memorable experience is when the private sector started to write large public sector medical schemes, and we needed a solution again for identification and for management of benefits. The traditional smart access with each member having a card was a challenge. And so again, SMART was able to go back to the drawing board and was able to come up with a solution that worked for us, that was able to be used for those large schemes. And so I would say those would be the two most memorable things that I can remember. But I think the point there is that SMART has always been very agile in finding solutions to the issues that we raise. And that is, I think, one of the most memorable things for us as Minet. Of course, over the 20 years, SMART has not remained static. We have since moved from, I try to remember, it's quite a while, whether we began first with just the biometric recognition first, and then possibly move to a more robust benefit management. And you see, as Minet, we're a bespoke solutions service provider, and so every client has a different product. And one of the things I'd say about SMART and evolving is that there is no challenge that we gave them that they were unable to surmount. So when we sold products where the benefit changed depending on how many children you had, then they went back and they found a solution for that. When we developed a product where you moved from maybe one grade to the next, they went ahead and found a solution for that. So in terms of evolution, they sort of grew with us as a business, they met our needs as a business. But of course, most recently, the move to a virtual access has been, I think, one of the most recent evolutionary things that SMART has done. And I think it's the way of the future. If you check the first world, second world,
service providers. We are going to automate the claim form. This is a form that has been with us for a very long time, but we don't have an e-claim form. So an e-claim form is something that we are going to bring on Connect, so that no need for those printing of invoice papers. Of course, this is going to be a collaboration between smart hospitals and the insurances, but it is a goal that we want to achieve. Business development. So how are we going to increase your business with Smart Connect? Smart Connect will ensure that you set up your own profile. As a hospital, you set up your own profile. That means you're going to tell all the 300,000 people using our app, this is what I do, this is where we are, these are our working hours. You create your own profile. So with that, the members are going to be able to triangulate you from wherever you are. Because of course, you know, we have geolocated all providers. So we are going to increase the visibility of your hospitals to the members. We want to reduce the rate of claims rejection. We know everyone here suffers at some point with claims rejection. What causes claims rejection? It is because you build something you're not supposed to build, you saw a member you're not supposed to see, you added maybe a service that you're not supposed to have. So how is Smart Connect going to reduce all these problems? Number one, we are going to use AI, artificial intelligence. So at the point of billing, we are going to introduce a feature that tells you what is the rate of this claim being rejected. Before even the member authenticates that bill, we are going to tell you that that service is beyond the price that they have set. We see the value in that is that you are not going to put yourself in situations that you have to explain why you did something. So we introduce AI. We also introduce better consumption of the rules that have been set by the payers. So the payers set rules that when I go to Mount Longonot, Naivasha, for example, I'm supposed to pay a copay of 200 shillings or whatever amount that is. So if at any point the person billing does not know what is my copay, we are most likely going to fall in a situation that you did not collect that copay and you're not going to be paid. So what we have done with that, we will ensure that these rules stream without any hurdles to the providers, so that when you are consuming or billing that member, you won't be in a situation where you bill something you're not supposed to. Payments tracking. So with the revamped EDI that you're going to introduce on Smart Connect, we will be able to show you where a claim is. The stages of a claim being billed and a claim being submitted, all the way to a claim being paid. We are going to show you, of course with rights, the people who have been given those rights, to see the claim journey. And with that, you will be having easier reconciliation processes, you will be having faster payments and visibility of even where your claims are. We have a new feature that you're calling information sharing. So we are going to enable this platform for you to be able to share information with other hospitals. You can be able to share your bed capacity if you want to. You can be able to share the services that you do for referrals and all that. Something else is that you're going to allow the members themselves are going to have a profile, an e-patient profile, where they'll be saving their medical history and they can share with whomever they want. So the last value proposition for Smart Connect is the use of data analytics. We shall provide you with data insights, be it on customer feedback. We are going to introduce what you're calling customer survey feedback. After a member has visited your hospital and they have exited, we are going to ask them, how was the services at your hospital? How do they rate you? So with that information, you will be able to make critical decisions as to the changes and the improvements you may need to do with your hospital. Something that, again, a new feature that we've done is you're going to be able to track system user behavior. As executive of hospitals, This is the first time that people will be logging in to interact with Smart. So you can be able to tell which cashier is doing what, which back office officer is doing what. So you'll be able to keep those logs and expose them to the necessary people. Payer behavior. This is married to payment tracking. You will be able to know who are your insurances that pay you on time, who are insurances that delay your payments. So, of course, that is going to inform some strategic decision making from the hospital. The other one is EAST implementation. As of now, if we release a new feature on SmartLink, we have to send our people to the ground. They come do those installations. So it takes some time before some people get to enjoy the features that we have. With this Connect being a web-based system, all the changes are going to be implemented at once at all hospitals. So a hospital in Lodwar, like my friends Lodwar Tumaini, they'll be able to access the same feature that we have deployed as Smart as someone in Nairobi. So we are going to have eased and quick implementation. So that is a value that Smart Connect is going to bring to the hospitals. So we seek for your support and positive feedback. Once we bring the solution to you, you know we are all here for you and we are about you. If you think there are improvements that once we've done the system to you, you can be able to recommend and we shall incorporate. So what is the value to patients, who is our shared common customer? As I said, they'll be able to locate hospitals. They'll be able to know. They can compare the costs from one hospital to the other and the value of care, depending on the feedback that was being done by other users. They shall be able to access personal medical records. Currently, if you go from one hospital to the next, you may find yourself, as a patient, in this case, you may find yourself repeating the same tests at two different providers. So that is going to, of course, escalate the cost of treatment. And if you had the chance of sharing those records, the file that you call a file in the hospital, if you can have this digital file and the member has it because it is their information. So if he moves from provider A to hospital X, they can just tell them, this is my record. That will be accessible. So we are going to introduce something we call self-registration for the member. Currently, on the VA app, you just start your visit, they give you a code, and you input it on SmartLink, and you search the member. So we are going to personalize that code so that when I come to the hospital and I initiate my visit, I'll be able to share my biodata with you. So what that means is, these repetitive questions that you always have, what is your name? What is your age? What is your gender? When you're registering, if I can be able to automatically give you that information without you having to ask me, you only ask me maybe that information or that piece of data that is not common at all hospitals. We can agree that the registration process is more or less the same in all hospitals. We have actually compiled that form and have a form that the patient will be able to self-register. That will also be combined with online appointment booking. As I had said, we shall be able to have an appointments module where the members can book appointments with you, check the doctor's availability, reschedule, all those functionalities of an appointment booking platform. So we're also having telemedicine. You can imagine a world where you can see the doctor or people are going to see you at the comfort of their home. This means that if the doctor I want to see is in Maralal, I'll just do that from the comfort of my home. Of course, there is patient engagement. Patient engagement is married to the reviews. They are going to give you reviews. They are going to check queue status. They are going to do referrals. You are going to have a referral module where two hospitals are going to share the same information. Of course, there is a feature that there is a feature for cost tracking. You can be able to view your utilization tracking. So, ladies and gentlemen, that is Smart Connect. It is a solution that is past cooking, and it's almost at your plate for your consumption. So we seek your support. Once this solution comes, please accept it as you have always accepted our solutions, and it's going to make your work far much easier. So apart from Smart Connect, we have other innovations that we are bringing to you. And I'm going to say that at Smart, we are dedicated to pushing the boundaries where it's possible in healthcare. One of the most exciting areas that we have delved in and are currently focused on is the pharmacy value chain and e-delivery of medication and medical supplies. So we are going to connect you with the people who are going to sell, and we have a platform that is going to ease all those procurement processes for you. So that is something that is in the cook. So another area of innovation we are actively pursuing is financial technology for healthcare. We are developing solutions like invoice discounting, where we shall use your invoice, or you shall use your invoice to seek financial facilities from banks and financial institutions. So this is another solution that we are cooking for you, so that if you want to expand and you're not very liquid at that point, yet Old Mutual owes you, an example, an insurance owes you 20 million. Can you use that to get a facility from a medical credit fund, and you're able to do your expansion? So that is a solution. And all this, we are going to do it automatically. There is not going to be papers. It's going to be an automatic process. We are coming out with a micro schemes management e-wallet. So this is going to be an application where the small schemes who top up their benefits through mobile money platforms are going to have to use the Smart app and top up that and access services at your hospitals. That is also a solution that we are building. We are also continually researching and innovating secure and cutting-edge technology around other forms of biometric identification. You know, in 2020, we introduced the one-time PIN. And as you can all attest, it has been a major success. So can we get other forms of doing the same? So that is something we are continuously exploring. So we are also continuously exploring, as I had explained with Smart Connect, is the use of artificial intelligence. How can we apply artificial intelligence in health? Can we be able to help the doctor do a prognosis faster than they can do it manually? Can we load the services, the medication, into a platform that is going to suggest things? Of course, we know the clinical regulations that are there, and we are going to have them in application. So, as we continue in our journey of innovations, the possibilities are endless. And with Smart leading the way, we are committed to driving change in healthcare delivery by delivering better services quicker and faster for everyone. So we call upon you to partner with us in this journey. We have the technology. We bring the technology. You bring the knowledge. You are the experts in the medical fields. We are not, but we bring the technology. And this is the perfect combination for guaranteed success. So together, we can harness the power of innovation and overcome the challenges, improve patient care, and shape the future of healthcare delivery. So let's join forces, make a difference in the lives of the patients in Kenya and abroad. Thank you so much for your attention, and we look forward to continuing this journey of innovation and partnering with you all. Thank you very much.
Thank you for that, Isaac. I'm just standing here at the far end in an event where we just want to take an opportunity for 2 questions at the same time in the interest of time. So if there's the delegate who has a question, you can raise up your hand. I'll bring the microphone to you, and then you can throw in your question.
Thank you very much. This is Benjamin again. The solutions looks very good, and in the long run, I know it will solve our problems, especially for the pre-auth. However, I have a concern because pre-authorization, the way it is at our facilities, let me talk about the government insurance, the NHIF. You know, NHIF, they have their own solution or a software that we use to do pre-authorization and claims, which is partly e-claim and partly manual. Now, this one looks to sort out those issues. However, I don't know whether you've approached the NHIF to give permission on using this to do the pre-authorization and e-claim, or it is a replica of what the NHIF has, so that after doing the pre-authorization and e-claim, you just push to the NHIF e-claim platform. Thank you.
Thank you for that, sir. Let's see if we can get any other question so that Mr. Isaac can respond to all the questions at the same time. Is there any other question? We'll close it off with the lady here, and then we can proceed.
Thank you, Isaac. My name is Gladys, Metropolis. You've mentioned one of the features is patients will be able to get access to facilities that have different insurances in them, including costing. Won't that create like a bias towards some of us and create some sort of price war?
All right. Finally, we have a gentleman here seated next to the lady. He said, please, we are together. Just consider this question as also as one. Go for it, sir.
Okay, my name is Alfric, Tionke Hospital. Is the system integrated with eTeams?
All right, thank you for that. Mr. Isaac, you can go for it.
Thank you so much for your questions. I will let our group COO answer the question on NHIF, but on the other question of price wars from the lady from Metropolis. So this is going to be an optional feature, because we cannot expose your prices. Only you should do that. When you're creating brochures, it is you to decide, are we willing to set our prices to be seen by users? Because all of you here, you know that you are targeting the same patient. Let's call them patient. You are targeting the same patients. So it's up to you to come up with tactics that will let the patient go to hospital A and not B. So that is going to be an optional feature. We are not going to force it to anyone. On the question of eTeams integration, I know my colleague Justin mentioned, we are trying to, or we are actually doing integration for all our systems with eTeams. So that is something that is there. Even the HMIS that Smart Health Plus, it is integrated with eTeams. So all your invoices that have been generated with that systems have the necessary fields for eTeams, or they are eTeams compliant. So yes, that is there. So Mr. Isaiah.
On matters NHIF, which we now know is transitioning to SHIF, we have had engagements with them a couple of times, but it is within their jurisdiction to see whether they can work with us. What we can promise you is that we are making our solutions usable and being efficient and interconnecting the various players. So we believe that when time comes and they engage us, we are ready. We are more than ready for us to give them service on that space. I think from what is coming up is that the government wants to work with other players including private players like ourselves. And as you can see, we have positioned ourselves. So I don't know if word can also go directly to them. It has gone through us. It has not probably been able to garner fruits, but if it can probably work with you, not a problem. We are more than ready to to work with NHIF or SHIF as at now. Thank you.
Thank you very much, sir. And back to you, Ian.
Please, let's appreciate Mr. Isaac Mushiri for a job well done. Thank you for that. Isaac, we also wanted you to give, to have the opportunity to give out this next prize. This is for the next raffle. So we're going to be mixing the questions. We'll have a bit of medical, a bit of sports, a bit of Kenya. I'll ask a trivia question, and if you believe that you know the answer, please raise up your hand. Whoever gets it correctly will have a gift package courtesy of So if you believe that you have the right answer, you will raise up your hand, and then now we can be able to proceed. But before I ask the trivia question, please, I'd like you to see the Mentimeter. We've been using the Mentimeter. You can be able to join menti.com, and the code that you can be able to use is 55146061. All right, so here you can be able to ask your questions on this particular platform. All right, and consider the question, what support do you require from SMART with the current regulatory changes, e.g. eTIMS? We can see the response, KRA eTIMS portal. All right, so we want you to have this particular access so that you can ask the questions. That is menti.com. The code is 55146061. In an event where we proceed and you have any challenge with that particular platform, raise up your hand. We'll get a representative from Smart Applications. The team is here on the ground to make sure that we can be able to support you. Now, for this particular trivia question, we need you to get the full answer, not just one word, but you need to give me the full answer for this. Which national park in Kenya is known for its annual wildebeest migration? I'll take the hand that is at the far end, the guy in the jacket next to the sound team. Yes, your hand is still up. Please stand up and give us the full name of it.
Masai Mara.
That's not the full name. Yeah, it's Masai Mara.
National Park.
National
Park.
No.
Reserve.
Yeah, reserve. All right, please let's appreciate him as he comes forward. And you're going to share this gift to the other 4 people who gave you the other answers. Okay, come to the front. Come to the front. Please, once again, you can address your subordinates. Just tell us how it feels to be a winner and probably what you're going to do with this gift package when you get it, please.
Feels nice. I'll share it with 4 people.
He'll share it with 4 people. Let's appreciate him as he comes forward, and as we look at the camera for the photo. Asante sana and congratulations. Let's keep the engagement. Makofi tafadhali ya Isaac one more time. Thank you. Great, fantastic. Now we want to go to our next speaker. Ladies and gentlemen, our next speaker is a man who brings a wealth of experience in his role, especially with a background in healthcare administration. And he has a strong focus on operational efficiency and also service delivery. His leadership was not only strengthened at Valley Hospital's position, but also as a leading healthcare provider. And he has also inspired positive change within the organization. He is the former group managing director, AAR Healthcare Holdings Limited, co-founder and managing partner at Rubik Health Africa LLP, and he is the managing director, Valley Hospital Limited. Ladies and gentlemen, his acronym goes like this. He is a transformation mentor and a results coach. He helps career professionals that are organizational leaders in Africa. That is what he focuses on as his bread and butter, and he's passionate about it to the bone and marrow. Ladies and gentlemen, help me appreciate the Managing Director of Valley Hospital, Mr. Mark Achola, a transformational coach, a leader who's able to work with people all throughout their career. Makofi tafadhali, we are glad to have you. Thank you, and we're looking forward to the conversation.
Good afternoon. First of all, thank you to SMART for having us here this morning. I think going into this afternoon, yeah? So Esther, Isaiah, team leaders, thank you very much. I think Ian has said a bit of what I've done in my career. And I speak from the provider perspective, of which many of us are in this room this morning, yeah? Or is it afternoon yet? Afternoon, okay? We have many problems, many challenges. We struggle with many things. And you know, many of my colleagues can relate to that. I always say, whether it's a hospital, whether it's a clinic, you know, it's a lab or whatever it is, we're like a supermarket. People come in every day for different things. And depending on the size of your organization, you have many professionals who are doing different things. And then we've got this difficulty called managing financial resources. So some of us deal with many insurance companies, some of us deal with cash payers, and everybody at the end of the day wants to give a good service or a great service because you want to retain that client and attract more. So how do you get all these people who do different things, give patients a great experience, and of course get a great outcome? Because ultimately we're here to provide care. It's hard. It is very hard. Because the people who come to us, unlike those who go to a supermarket, are not at their best. So they already come with anxiety and expectation. But then you've got these problems, you know, the system is down. I'm sure you know that. We are not getting the M-Pesa message. They've paid, here's the message. No, management said, if it is not showing on our side, we cannot. Because you know if you accept that payment and it's not there, somebody's going to deduct your money. True? So it's hard for those of us who are working. Then we've got all these other problems of patients who are coming, they give you their card and it's not them who are getting treatment. And then the insurance company writes a tough letter to me as the MD of the hospital and says, you know, Valley Hospital, we're suspecting you guys are doing fraud. And by the time I found out where this problem is, maybe it happened 3 weeks ago. Because I'm also busy doing other things. It is one fire to another. That's what it means to run a healthcare operation. You just don't know which problem is going to come today. But then, you have to look for a solution if you're going to be effective. Because human is to error, whether we like it or not. I am not perfect. Human is to error. So I've been in this healthcare industry for almost 20 years. And when SMART started, I was there, watching them. And it may not have been these ones you're seeing here today. There were some other guys who came before them. But they came to us, and I remember telling us, you know, we can eliminate fraud. And you know, like good Kenyans we are, we doubt them. Hey, prove it. Show us where it has worked. I had one colleague here saying, show us. I was in that group. Show us. Fraud, how? And they said, you know, we've got this thing, a fingerprint. We're like, that's witchcraft. Who can use a fingerprint to do what you people are saying? No, it works. Hey, okay. And that was in the mid-2000s. And I watched this company struggle. Let me be honest, I watched them struggle. Because we refused. We refused this solution, I promise you guys. This one that you're seeing is biometric today. We rejected it. The industry rejected this solution. But you know what? While we are rejecting this solution, our problems are not going away. Because I can tell you, we used to use lists. When patients come, you have to go and check a list. Is Makachola there? Hey, how long will that take? So at some point we got sober. And we decided, maybe we need to listen to these guys. But you know, us on the provider side, we were negative. So insurance companies came. And they came with force. And they said, from today going forward, you will use this thing. Now many of us didn't have computers. Now we have to go and buy what? So we tell them, okay, is the insurance company going to buy computers? No. So now they want to bring us something that solves our fraud. I have not budgeted for computers and I have to buy. But the insurance company says, if I don't use this thing, I'll not get paid. So we were forced. And we bought. And for many of you, because you maybe have joined this journey along the way, that is how computers came into healthcare providers. It came by force. You many of you have found them there. You don't know how they came. If you look at those directors over years, do they look like guys of computers? Well, don't answer that question too loudly, please. And the journey began. And we realized, hey, this thing is good, I no longer have to go through a list, check emails, who is suspended. No. Just put your finger, what? There. Magic. It works. We doubted them. They never gave up. The providers refused. They went to the insurance companies agreed, and they forced us. Now it's 2024, and here we are, the guys sitting in the room smiling like we've been happy to have this thing. We were not. Let me tell you, we were not. You guys are the guys who are lucky. In fact, I should be ashamed to be here because I was part of that group that said no. But because I've watched them grow over these years, and I have my colleagues here from Valley Hospital, just wave your hands. Thank you very much for supporting me by coming here. I hope you came for me, okay? I want to tell my colleagues here that we have problems. But when you look for solutions, you need to look for two things. One, actually three, let me say three. There's a technical side to technology. So you must have your technical people. Okay? Because you want something that works. So you must have your information technology specialist, whether in-house or outsourced, to tell you, is this thing solid? Is the engineering good? Because it's science. That's number one. Number two, and this is the biggest challenge, will my staff be able to use this thing? Because that is where the thing goes south. And that is what has ailed healthcare and technology. The users struggle. No matter how much you do as me as the leader, if my team does not use a solution, it is useless. So we call it user experience. Is the user experience good? Is it easy for them? Like we always say with one of my colleagues in the business, how many of you have ever gone for a training on how to use Gmail? I went to class, we like going to school. Okay? Who has a certificate here of how to use Gmail? Just put your hand up, we clap for you. Ian, where are you? We need to give prizes for this one. I was trained on how to use Gmail. Nobody. How many of you use Gmail? Put your hand up. Almost everybody. Then why is it that when we bring things to the hospital, now you are like, are you not the same people who use Gmail? But you see, that's what SMART has to deliver to us. Something that my colleagues can use easily. I'm not saying that it should not be there, should not be any difficulties, but the easier it is, the easier it is for me, and the better it is for them. Why? Because we want more. Then the third thing we must look at, and now this is for decision makers like me, if you're in the room, will this company be there in the next 10 years? Because I have worked in all those places Ian was talking about. I have met problems where companies closed. And here you are with this technology stuck. You don't know what to do. Because the thing about information technology, it's not regulated. They're regulating data, correct. But the things that generate data, they don't regulate it. So it's an open for all. Even me, I can live here, go with my computer, learn how to code on the internet, and then tomorrow I say, hey, Makachola HMIS Plus. No one will stop me. So it's a free for all. So every guy is walk into your office, your hospitals, clinics, labs, and are telling you, I've got the solution for you. Hey, who are they? Will they be there 10 years from now? Because let me tell you, when you have a problem and you're calling them and you can't find them, you know what it means. Because patients are there, waiting. What is taking so long? What is happening? The IT guy is saying, I thought you went for training. You IT people, what are you doing? You don't even know what your system can do. That time they're looking for that guy, support guy, cannot find that company. And then the guy says, oh, my phone lost power. I go, oh my God. Surely, you're trying to support a big business with, and you cannot charge your phone? You can't work with those kind of people, colleagues. Let me be very sincere. Patients will never forgive you. Never. So when we make a decision in Valley Hospital, because that is where I am, but when I make a decision as a healthcare management professional, I look for those three things. And those three things are equally serious. And to be very sincere, because I've been in this sector a long time, SMART ticks the box on all three. It doesn't mean they're perfect. Let me be very clear. They're not. But they're doing a great job, okay? And let's give them a hand, please. Let's give them a hand, yeah? They're doing a great job. Because they take all those three boxes for me. So it means I still have problems, but there's some they are solving. And now that they're showing us a lot more, basket, there's some more in their basket, yeah, we're listening carefully. We'll wait for you to come and talk to us and tell us, hey, this is what I meant when I was in Sarova, this is the thing I meant. We'll be like, okay, does it tick those three boxes? If it does, Valley Hospital will support you, rest assured. If you want colleagues here to come and talk to us and say, show them, because some of us want to see, then bring them. Bring the colleagues from industry. We have nothing to hide. Bring them. The more we collaborate as providers to teach each other things, the better for our patient. Bring them. Isaiah, bring them. Esther. Alex, bring them. We'll show them what we do. Because for us, technology is serious business. In Valley Hospital, it's serious business because we want to solve our problems and give our patients a good experience and an excellent medical outcome. And technology for us is serious. So, as a provider representative, which I'm speaking on your behalf, I want to tell you guys, there are some solutions here. Many of us are using them, especially the biometric. Nowadays, it's like normal, Do you have smart? If you don't have smart, then I think you're funny. You understand me? Maybe you don't do insurance company work. But all of us, 90% are using a smart solution, and it's great. For us, we've looked seriously at their health management information system. We've looked at it as Valley. We like what we see. There are some things we feel they need to put in there. I think we were open enough to tell them as much. And they're responsive to our need. And that's another thing you need. A technology partner that can, tell us some things to your need, because all of us have unique issues happening in our facilities. We're not all the same. I want to appreciate that. Well, we do similar things, we're not 100% the same. So feel free to put your need on the table. Their job is to see how can they meet your need or not. Because we also want transparency, my colleagues from SMART. If you can't do it, tell us. We'll just make a decision whether we agree with your decision or not. But don't string us along and say, you know, it's coming in 2 years. Hey, my problem, and this is like healthcare. Our problems are what? Here and now. So mine is to say thank you very much. It's so far so good, guys. Yes, we doubted you. But you've proven yourself. You've proven yourself. So you know what? Be better, be greater, bring us more. Thank you.
Be better, do better, bring us more. Did I get it correctly?
Absolutely.
Okay, thank you. Please, let's appreciate our speaker one more time. Thank you, sir. We also just want to find out if people can be able, do you have an open door policy? In case I want to come and see Mr. Ocholo, I can be able to come and see him. Is that okay with you, sir? If we have a question? All right. We'll find a way. We'll find a way. Let's appreciate our speaker one more time. We appreciate your leadership and also the many people that you've been able to impact and also turn them into transformational leaders. Right, now we want to go to our next speaker. Ladies and gentlemen, please give a high five to the person sitting next to you and tell them it's Smart O'Clock. Smart O'Clock. Smart O'Clock. All right, fantastic. Now we want to go to our next topic, which is on the Smart Partnership Request. Our next speaker, ladies and gentlemen, I was having a conversation around this particular venue, and they were telling me that our next speaker is a perfectionist. He does everything with excellence, and he definitely has attention to detail in everything that he does. He is a person with a high propensity for quality and excellence, and his aim is to implement the various keys for success, such as integrity, ethics, leadership, teamwork, training, and continuous improvement to learn and experience the new phenomenon in information technology and statistics field. He is passionate about this particular region, passionate about what he does. And let me tell you one thing, ladies and gentlemen, he's a man who does everything that he does with excellence. He's a regional manager, Rift Valley region. We are in his region, ladies and gentlemen. Let's appreciate Mr. Alex Mwangi as he comes forward to guide us on the next presentation. Thank you for hosting us, sir. We are glad to be here. Asante sana.
Hello, ladies and gentlemen. You are looking amazing today. Thank you so much for gracing this event. Once more, can I hear from two people very quickly? What are your expectations from the forum?
There's a colleague, there's a hand. Oh, see a lady there. Just raise up your hand again. Just confirm.
Hello, my name is Margaret from the Dentist Limited. As I was coming in, first I usually meet Alex at our facility, and I used to wonder, doesn't Smart have offices? But now I've seen there's a whole team of Smart. Number two, I have a question. Apparently there's the copay bit, and I was wondering, can't Smart give us an option whereby if a client is supposed to do copay, it can just pop out, so that most of the time facilities miss out on copay? I don't know whether it's only our facility or other facility have that. So we are happy to see that SMART has a whole team. And we are also happy to see that apart from the SMART access, there are other things that as a facility we can look up to on SMART. Thank you so much.
Thank you. There's a gentleman.
Gentlemen, media team, if you have a mic closer to him, you can be able to pass it to him. Then I can handle this region.
Hello. Hello, I'm Jambo. You can hear me, eh? My concern as a patient is, since you're implementing SMART, how safe is my information online or in the system? It's more about data privacy and cyber security. I think that is the only question. My only concern is that, how safe is my information? Maybe I don't want somebody else to know what I'm going through. How safe is my information? Neza pata leak, or is it fully safe? Thank you.
Thank you so much. I let our group director answer the questions as I finish my presentation. And to answer a question I've been asked by many, yes, there is food. Alex Mwangi is my name. Hospital operations, Rift Valley region. A vast region spanning across 14 counties, Nakuru County, Kericho County, Nandi County, just to mention a few. A land of many amazing things. We have flamingos, we have marathon runners. And not to sound political, and on a light note, we have also bestowed upon the country with not one, but two presidents. Smart Access is our latest world-class solution. It is a mobile app for members. Members can access medical services on the go without a physical card. You can get the app on Google Play Store for the Android users and for App Store for the iOS users. Members can initiate a visit using the app, generate a member access code, which is used by the hospital to start a visit. Members can also will be able to check the family members who are covered within the family, that is the spouse and the dependents. Members can also check the utilization from the app. Members will also be able to check and confirm whether they are active or not and access the allocated benefits. The app provides members with the latest information of areas of interest like wellness. We have healthcare articles on the app. For example, we have articles on pregnancy, cigarette and alcohol. Members can check whether the cover is renewed. This is upon expiry of the scheme. Members will be able to geolocate the provider location, and the app will provide a guidance on how to get there through a Google map. For those without a smartphone and the commonly known phone, Mulika Mwizi, there is a USSD code, *891#. Members can also initiate a visit using the USSD code and access the same features. On the member-patient journey, members will start a visit on the app or via the USSD, generate a visit code. You input the code on SmartLink, then you will authenticate the member using an OTP or a fingerprint. The OTP can be sent to a registered phone number or a valid email address. The member benefits will be in the balance will be displayed. Then you continue with the normal SmartLink billing. For the first time access, the member will be required to register a fingerprint. For the children below 5 years, we request you register the guardian or a parent. We also have additional manual search on the smart system. That is, you can search using the member name, member number, phone number, and ID number. Then now when it comes to the billing process, we have two types. We have the integrated SmartLink and the capture. To explain in simple terms, the integrated SmartLink, if you have a hospital management information system and you have already generated an invoice, that invoice with the diagnosis and the line items will be pushed to Smart. So you're not required to bill an item one by one. Now for the capture billing process, the cashier is required to capture manually the line items as indicated on the invoice. Our partnership request, data quality. We request our medical service providers to provide us with complete and accurate data. As I have mentioned, the cashier is required to capture the itemized bills as displayed on the invoice. That is the consultation, drugs issued, lab tests that were done, radiology, then the procedures that were done. You're also supposed to capture the correct invoice number and the diagnosis. Currently we have the ICD-10, but we'll be updating to ICD-11 as we progress. For the integrated providers, make sure your system passes the itemized bills, service items and the unique item codes. Also, you're supposed to ensure that you capture, the system captures and passes the ICD-10 diagnosis to SMART. We are moving from the database integration to Smart Connect API integration, which is more secure. Provider engagements and strategic partnership plays a vital role in driving innovation, improving healthcare delivery, and addressing the complex challenges being faced in the healthcare industry. This provider forum forms part of that provider engagement. We also urge you to adopt our product, that is the Smart Healthcare ERP for automation of processes, which is customized to fit various customer needs. We have a Smart Analytics. This is a platform that transforms data analysis and business intelligence to gain a competitive edge and drive data-driven decision making. We also have a time and attendance success control. This is a security and employee management solution that records employee working hours, manages shifts, and offer restricted access to unauthorized personnel. Just to highlight some of the products that we have. Ladies and gentlemen, as I conclude, we acknowledge collaboration is key. I invite you all to try our various products and give us honest feedback. I assure you, we will listen. Together, let us strive for a healthier, happier future for everyone. Asanteni. Of Purity, you can answer the questions that were asked kindly.
All right. So we addressed the questions that were being asked?
Yes, there are two questions. I think Purity will address them.
All right. Purity?
Good afternoon, everybody. So I'll address the security. There are two questions, one on copay management and the other one on security. So allow me to start with the security one. Yes, as you all know, from 2019, as a country, we adopted the data protection law. So even you as hospitals, you are affected to ensure that you maintain the data privacy because the data subject is the patient. So one of the key things we've done as an organization, one, we are registered as a data processor and a data controller. Why? Because that's what we are required to do by law. Because under those two registrations, there are things that we must adhere to when it comes to handling of data, patient data. The other one, we are also adhering to the GDPR standards in terms of data protection. This is a law that is in EU, but if you look at data protection laws across the countries that we are working in, most of them have borrowed a lot from there. In addition to that, I'll be a little bit technical. I assume the gentleman who asked, I can see him nodding his head because I can see he's very technical. We've also done data segmentation in our system. What that means is that if data is coming from Valley Hospital and some other data is coming from St. Mary's, they will never mix. And data that is coming from St. Mary's for Old Mutual and the data that is coming from the same hospital for CIC, it will never mix. Why? Because we've segmented it in such a way that we are able to tell where each patient belongs, and it can only be accessed by authorized personnel under those respective institutions. The other one is the encryption of data. As you all know, how many of us have seen what has happened at Equity? How many of us have seen that? It's all over the social media. Some of us are a beneficiary of that. It might be. That's why we are not putting up our hands, but don't worry. So what we've done is to encrypt data so that even if it's on transit or stored, nobody can be able to decrypt what that data means until it's being accessed by the right application and the right person. Now, one of the key things we're introducing, especially on the hospital side, like has been said by, it was said by Isaac, is also to introduce role management on Connect, so that if you are a biller, you access the billing information. If you're a credit controller, you access the finance information. That's another way of also helping you as an hospital to ensure that we deal with data privacy. The other item that we've done, we've whitelisted people who can be able to access our systems directly, especially through integration. We are big on integration, both on the hospital side and the customers, the insurer side, so we have to ensure that we actually restrict who can access, and also from what region. If, for example, you are in US, you cannot access our systems. Why? Because we do not operate there. Maybe when we get there, we'll be able to allow you. The other one is that we are also certified ISO 27000. That's a standard that looks at security, and for you to be certified, you must have achieved all the set standards. As we speak right now, we are going through another certification, which is 27001, which is on privacy management, so that then we also ensure that we are also following the standards that have been set when it comes to privacy management. I'll go to the other question on copay management. The process is already there. I believe the lady who asked, the person who is in charge of managing that provider has seen the person. Please go and ensure that it's properly set up, because it will notify you. It will not only notify you, the system will not only notify you, but it will also force you. Remember, we have people who are changing shifts from one time to another, new people joining the institutions, so it will also enforce collection of copay, in that the system will not continue until you provide a receipt number to show that you've collected the money, and much more in terms of that is coming with Smart Connect. Thank you.
Well captured, Purity. Thank you for your attention. Enjoy the rest of your day.
Thank you. Let's appreciate Alex, Regional Manager, Rift Valley Region. Tupige makofi tafadhali. He's done a fantastic job. And he is the man in charge of this region, and we are glad and honored to have you here. Before we proceed to the next speaker, I'd like to just acknowledge the insurance representatives that are here in the house. We just want to request if you can all rise to your feet. All rise to your feet. The delegates who are representing the insurance sector, you are from an insurance company, would like to request if you can rise. Wherever you are, you can rise. Those are the only ones that are here? Okay, delegates, please, let's appreciate them with a round of applause. We are glad to have you here. I believe Mr. Albert Rotich from the Kenyan Alliance Branch Manager Nakuru is here. Just raise up your hand, Mr. Rotich. Please, let's give the microphone to Mr. Rotich for just a minute so that he can be able just to address the delegates here in exactly just 1 minute. Mr. Albert Rotich, he's a branch manager Nakuru, Kenyan Alliance. Over to you, Mr. Rotich.
Yes, good morning. Good afternoon, everyone. Okay, my name, as you've heard, is Albert Rotich. Mine is just to say thank you, Smart, for the work that you're doing. Of course, you have demonstrated for the last many years what you can do. Our clients actually are safe, especially in terms of data and what when they want to access their medical services. Thank you so much, and God bless you.
Thank you. Let's appreciate Mr. Rotich. A round of applause. Thank you for that, and thank you for that powerful testimonial. Definitely, clients' data is safe when you are with the smart applications. Thank you, Mr. Rotich, for that. Ladies and gentlemen, we want to go to our next speaker, and he's going to guide us on the next topic, which is on MediSmart Insurance, the scheme administrator, and also payer provider engagement. To guide us on this particular conversation, ladies and gentlemen, is a man who has been instrumental in driving the strategic direction of the insurance business here at Smart Applications, and also leveraging advanced digital solutions to enhance efficiency, customer experience, and also profitability. One of the things that stands out about our next speaker is his deep understanding of insurance operations and also the market dynamics. It is my pleasure, ladies and gentlemen, to introduce to you a visionary leader, the head of insurance business at Smart Applications. Put our hands together for Moses Wenjera as he comes forward. We are glad to have you here. Welcome, Moses. Karibu sana. Tupige makofi tafadhali.
Good afternoon, everyone. Mr. Ian, at least today you've made me know something about me that I didn't know. I was even surprised. I didn't know if I'm the next speaker. But I'm glad to be here. My name is Moses Mwenjera from Smart Application as the head of insurance. And I've only seen a few people from the payer or the underwriters. And I'm here to represent you today in terms of the expectation that you would like from the provider side. So I would like this to be an engaging conversation. And I can first of all begin by asking who is a customer. I don't know if there are gifts for that. Any hand? Who is a customer to you? Wow. You know, I'm the link between how you guys are having lunch, as Mr. Alex has said, so we need to be proactive. Yeah, there's a gentleman here in front. Maybe you can give him the mic. Mr. Ian.
Briefly, I think a customer is anyone who is in need of a productive service, who needs a productive service.
I think let's give him a clap. Maybe we look for a gift for him. What's your name?
My name is Godwin Bear.
Okay. Eunice, make sure you locate Godwin and give him a gift. So Andreas, you can put the PPT on. So my presentation will be quite brief because as you've heard, there are so many products that have been mentioned by my co-colleagues. So you will hear a lot of terms that are interlinked. But as you've heard even from Connect, there's a lot that we will be working in line with all these products. So I'm going to talk to you through these 3 items. One is the Smart Access solution, Smart Pre-authorization, and Smart EDI solution in line with what the payers expect from the providers for a seamless working journey. So for the Smart Access, I will not go through everything because my colleague Alex has already talked about it. What I'm going to highlight is 1 or 2 things in terms of the customer journey, patient process, and member empowerment. So as you've heard, the customer journey starts from onboarding. Remember previously, and like Mr. Achola has mentioned before, 20 or 18 years down the line, there used to be a cumbersome list that used to be given to the providers where you come and just check if the member is on cover or not. But currently we are offering near real-time onboarding where customers anticipate a swift and efficient onboarding process. With that, we'll kill the time of them waiting to be confirmed in terms of them having a cover or the benefits that they have. The other bit is on member notification, where we send a personalized notification showing them the benefits that they have. So in case they are the benefits that they have and the limits that they have. So they can be able to track the benefits in terms of the utilization and all, and they'll, in case the cover is getting depleted, they can be able to know that they need to carry more cash so that they can get the full services. The other bit is a simple sign-up process, which is user-friendly. The process is quite simple because there is a link that you're going to get with the steps on how to use the application. I'll go to the patient process. I think that has been demonstrated clearly by Alex, where he showed the specific app and the process on how to log in. If you don't have an Android or a mobile that can accept applications, you can use the *891 hash code. The other bit is on member empowerment. Member empowerment is quite key, where we collaborate with brokers and underwriters in terms of engaging the members to know their benefits and understand their cover more. We also do offer joint meetings. I know it has been mentioned there. And this helps in learning more, especially into peer and peer learning. The other bit is expanding the knowledge base and understanding the industry-related challenges. And with this, Smart as an innovative company, we usually do this so that we can be able to chip in and enable that the challenges that you're having, we can always keep on improving them to be much easier for you guys. I'll move on to the next bit. So I'm going to speak through the smart pre-authorization process that we enrolled. And this is where I would like the team to support us fully. For this, there are so what is the provider requirement and the ask from the providers? One, the underwriters would like the providers to capture complete pre-authorization details, which includes the measurements of the readings of the eye, the diagnosis, any procedure that you do when you're raising a pre-authorization. And how does this benefit the claims processing bit when it comes to payment? They are usually reduced rejections because the payer will be able to see what was billed and how it relates. For example, if I give one of the reasons, you can have a pre-authorization where needed 2 diagnoses, and one of the diagnoses is not entered within the system. What will happen is that part of the details that you're going to administer to the patient might be rejected just because you did not indicate a diagnosis that could have explained the reason for that treatment. The other bit is providing email and phone number. For this, it's because of streamlined communication. Remember, he answered a customer is someone who needs services. So within the healthcare industry, for the patient, he's a customer to the provider. And for the provider, they are a customer to the payer. So if the details, the email address and the mobile numbers are complete, there will be a communication to all parties, and they can be able to track their pre-authorization, whether it's approved, whether it's pending, and the status of the pre-authorization. The other bit is process change management, and this is where I would like, again, you, the providers, to support us. So some of these requirements that we get and come to them with you are usually requested by the insurers or the underwriters. And what usually happens is that when we enroll those products, we find some of the providers usually rigid in terms of adapting to some of these changes. But for smooth transition and requirements from the payer, it's very key that you do support us for even being able to have operational efficiencies without having any issues in terms of the payer not paying you because you didn't follow the right process. So what are the benefits to the provider? One, the single system use in billing and pre-authorization. Remember, you will do a pre-authorization within the system. Initially, what used to happen, and I know this is a work in progress for outpatient benefits and inpatient benefits, but for the opticals that we have integrated with, you bill on the smart system rather than sending an email to the payer for them to respond, and then you start billing on the system. So currently what is happening, you bill, you raise a request on the smart system, it's pushed to the payer approves, and once you bill on the claim, they auto link, and it's you get accurate details. The other bit is TAT tracking. So performance and measurement is very key. Performance and accountability. Once we introduce these two in terms of the billing process, you will find even the quality of work that is being administered to the patients will improve. The other bit is ability to reserve the amounts. So you will not have issues of having excesses where you build a client, then later on the payer is telling you they didn't have a benefit. And that is something that will be eliminated. So there is also improved customer experience and transparency. Remember, when I mentioned about the SMS and email, so the patient will not keep on coming to ask you whether the pre-auth has been approved, because they can see it on as a message, and they'll be able to track. The last one is on integration. So for the integration, you can see it great. It's something that we are working on, especially on providers who are using their own system, and we are not integrated, but it's work in progress for the pre-authorization. So lastly, I'll speak through EDI. So what is the provider requirements and they ask from the payers? One is complete capture of a claim. Complete capture of a claim includes diagnosis, like I explained, the invoice breakdown. So you find that some of the providers do not want to go to a granular level to indicate what they are billing. And what happens at most is that it brings a lot of back and forth in terms of reconciliation between the payer and the provider. So the other bit is on attachments and reduced document attachments. So with attachments that you upload on the EDI platform, it reduces a lot of document requested from the payer. And also in terms of costs and logistic, you will not have to put those claims in a courier, send them to the payer. It's quite hectic, and it's going to be very cost effective once you do it on the platform. Sorry, it's moving fast. The other bit is on automation. So there is easier reconciliation for payments. Like my colleague Isaac mentioned, the introduction of AI, which is something that is on work on progress. It's going to make life easier in terms of doing reconciliation for payments, because the details are accurate. The other bit is on complete claim switch. So for the claims that will be transmitted to the provider, they will be quite accurate in terms of what needs to be checked by the underwriters, and they'll make an informed decision in terms of paying the claim. There's also efficiency. The error rate will reduce. Remember, this integration will have you capture the actual details within the system, and the integration will be pushed to the payer as is. The other bit is on EDMS Autolink. So a paperless drive. We are all talking about going green. This is part of an initiative that we can all be part of, where we remove paperless, we go paperless, and be part of the Going Green initiative. The other bit is on early payments and auto vetting. Like we said, there is the machine learning and the straight-through process. Lastly, There's analytics, which my colleague will come and talk to more about it more in terms of clinical analysis and patient traffic. Thank you very much, and I would like to hear if there are any questions.
Yes, indeed. Thank you, Moses, for that. We had shared, let's appreciate Moses first of all, with a round of applause. We had shared the code to our delegates for the Mentimeter, menti.com. We can see some questions that have been coming in. We would like the media team to just display one of the questions that have come into the platform. As smart applications, we are going paperless, so definitely we are going with the digital transformation. All right? And I believe that is the one that is being highlighted. For those offering home care services, will we be able to bill insurance clients from home, Mr. Moses?
Yes, we will be able to bill. Even right now, my colleague has talked about telemedicine, where they usually visit your home and or wherever you are. They will come with a smart link. They will bill you, and you'll be able to get your medication. So even for home care services, that is very possible. I know COVID taught us a lot, and I believe we can do anything from anywhere. So that is very possible.
Right. Thank you, Moses, for that. He's the head of our insurance business here at Smart Applications. Before we let Moses off stage, we have also another prize that we want to give out here, and it's a fully branded water bottle courtesy of Smart Applications, all right? We want to give this out, and we want to just ask one trivia question to the delegates here. What is the medical term for high blood pressure? First hand, the lady here. Hypertension, please come on stage, please come on stage. Let's appreciate her, she comes. Congratulations, please tell us your name. Talk to the lower class people over here and tell us how it feels to be a winner.
It feels good to be a winner. My name is Jane. I come from Metropolitan Chemist Nakuru.
Wapi makofi ya Jane. Congratulations. She says it feels good. Let us see how fast we can be able to do it. One more time, please. Let's appreciate Moses with a round of applause. Thank you for your leadership, Moses, especially here in the insurance business. I would like to request all of us, please, if we can just rise to our feet. We've been just seated for a while. Let's all rise to our feet. I'll ask Purity and Barbara to join me on stage. Purity and Barbara to join me on stage. You can stand behind, once again, behind your seat. Put it under the table, and then I want all of us just to face forward, face forward, face forward. Barbara, Purity, join me on stage, and also our regional manager, Mr. Alex. Alex, come and join us on stage. We cannot dance in your region and you're not here on stage with us, all right? Just join us on stage. Let's appreciate the best dancers at Smart Application as they come forward. They're well known, they're well known, they're well known. Right, right. So this is what I want us to do. Let's put our hands up here. Let's wiggle those fingers. It's like you're calling for money, all right? But no witchcraft there, all right? And then I want you to pump your hands like this. Now, the ladies in the room, you can be able just to move your waist a bit, just a bit, all right? We have senior officials here, don't go too hard, all right? All right, fantastic. Now, for the ones who are on stage here, I want us to face forward like this. We do the same thing. Let's put our hands up there. Let's wiggle the fingers. Let's pump our hands up like this. Move the waist a bit. And then I want you to stretch your left hand forward. Stretch your right hand. Take it to the shoulder, to the shoulder, to the waist, and then we turn to our right, all of us. Let's do that. Now we're facing this side. We're facing the buffet section. Yes, yes, we'll be there shortly. Now stretch your left and your right. To the shoulder, to the shoulder, to the waist, another right turn. Now we're facing back. Stretch your left, Your right to the shoulder, to the shoulder, to the waist, another right turn. Now stretch your left, your right, the shoulder, to the waist, and turn. Fantastic. That is a smart application to the world 360. Ladies and gentlemen, they usually say that this is best done with what? With music. Thank you so much. Mr. Director, give us that song. Oh my goodness. You may have your seats. You may have your seats. Ladies and gentlemen, we want to go to our next speaker, ladies and gentlemen. And our next speaker is she has experience in harnessing the power of data to drive strategic business decisions. And one of the key things that she's going to be taking us through is on the smart analytics. She's the business intelligence analyst at a smart application and also my core dancer. Ladies and gentlemen, help me appreciate with a warm round of applause Barbara Simiu as she comes to take us through this particular conversation. Makofi tafadhali for Barbara. Glad to have you, Barbara, and we're looking forward to your insights. Thank you. Welcome.
Thank you, Ian. Hello, everyone. It's my pleasure to be with you all today. Baraka will help me with the presentation, just as it comes up. So, as Ian has alluded, today I'm going to venture into the world of smart analytics. It's a very fascinating world, and forgive me, Ian made sure I danced before presenting, so I'm a bit out of breath. But so the world of smart analytics is very fascinating, and as we go through the journey, you'll see not only how it's able to revolutionize a business, but also how it's able to foster better decision making. So we're going to start with our footprint. I know most of my colleagues have gone through the smart footprint. They've told you our journey, who we are as smart, but I want to look at it from a different perspective, from the data perspective. So you'll see that the slide does not only illustrate our robust footprint as smart, but it's particularly shows our strong positioning in the healthcare data space. Our presence in 11 countries underlines our commitment to advancing healthcare through data. So we are really harnessing data throughout the 11 countries that we are present in, with over 2 decades. So as Isaiah had mentioned, we are 21 years old currently. We've built an impressive network supporting over 8,000 healthcare facilities and managing over 100 million transactions. You can imagine how 100 million transactions look like. That's like 100 million shillings, but now in claims. That's a clear reflection of our reliability and our expertise when it comes to healthcare data. We also have a strength in our people. So we have a diverse IT pool of staff of over 300 in the 11 markets that we are in. And these staff are always ready and they bring their expertise to bear or to tackle any complex data challenges that we face. So as we delve into our smart analytics product, consider this, our rich data heritage. So we are bringing you very rich data that empowers you and with actionable insights for smarter healthcare delivery. We look at our unique positioning. We'll talk about what sets us apart in the dynamic world of healthcare data analytics. Of course, we often hear data. Data is a buzzword currently, and we often hear that data is the new oil. But it is the insights from the data that are truly valuable, because you can have all the data that you have, but if you can't derive insights from the data, then it becomes almost useless. So these insights, these valuable insights, they're the gold nuggets that drive change. Our unique position comes from 4 key strengths. Number one, we have a breadth of expertise with various platforms. So we are platform agile when it comes to analytics, whether we are talking about Google, we are talking about Microsoft, Oracle, we are talking about ClickSense, the coding platforms like Python, which enable us to be platform agnostic and flexible according to your specific needs as a client. Secondly, we don't just gather data. Our in-house expertise is skilled at digging deep to unearth valuable insights and trends with a strong foundation in data science and analytics. Third, our broad industry exposure. As we've said, we are over 2 decades old in the industry, so our exposure and our experience across the sector makes us adaptable and insightful, and we are capable of understanding the unique challenges and opportunities in healthcare. For example, if you were to call Esther here and ask her where is the best place to open a dental clinic in Nakuru, she would tell you off of her mind because of the expertise that she's been able to build on over time. Lastly, we, as Purity mentioned, we maintain strict data governance, ensuring the integrity and security of your data. We see data protection as a paramount responsibility to us as Smart, ensuring that your data isn't just insightful, but also safe, so you can trust us with your data. So together, these strengths forge a very unique positioning, enabling us to deliver unapparelled. I don't think you can be able to get the data insights that we are able to provide in the industry, so we are unapparelled when it comes to the unique positioning that we offer. We'll move on to the capabilities that we have in analytics. So our analytics capabilities, and just to mention a few, just to show you what we are able to do, are at the core of the Smart Analytics product. It's designed to provide actionable insights and support informed decision making. So this is where you're making decisions based on evidence and based on data. You're not just using a hunch and saying this is what I think is right or this is what I think might work. So here is what we bring to the table. Number one, we have operational effectiveness assessment. This is where we analyze your processes to identify efficiency gains, cost savings, and quality improvements. This includes doing analysis on things like TATs and seeing how you can be able to optimize your TATs to make service delivery better. We also have regional demographic dissection. So we are able to examine demographic data. This is geographical data. So we can pinpoint healthcare needs specific to different regions that you're focusing on. And this allows us to tailor service provision. So for example, you wanted to look at Nakuru and the trends around Nakuru. Maybe the county government wants to look at how healthcare is performing in Nakuru County. We are able to provide that because of the wealth of data that we've been able to collect. We also do trend analysis of disease prevalence. So our tools can track and also predict disease trends, aiding in public health planning and resource allocation. We also have service-specific clinical evaluation. So on top of giving you the diagnosis of the disease prevalence, we are able to dig deeper into that data and look at the treatment types that are being given for these diseases, what are the medications that are being prescribed, so that we can see if they adhere to the correct treatment types, or you can also see what is being used commonly in the market as treatment types for different diseases or diagnoses. We also have growth location guidance, and this has been mentioned by Esther and Isaiah as well. So where for expansion strategies, we provide insights on where the demand for services is growing based on different growth indicators, and we are able to guide your strategic planning. We also have performance forecasting, where our predictive models can forecast future performance. So looking into the future and anticipating what you could be able to get in the future in terms of different performances, whether you're looking at utilization, predictions on which diseases might come up or might spring up on different seasons based on the historical trends that we've seen. So in essence, our capabilities span from very micro level, or what we call operational level, of individual service quality, to macro levels, the bigger levels of strategic expansion, all powered by data. This multi-layered approach ensures that every facet of your operations are informed by the best intelligence that is available. So we were able to do some sample analytics just to show you what we are able to do with the data that we have in SMART. So we did a specific case study of our analytics in action, where we conducted a sample analysis of the healthcare landscape in the region, covering Rift Valley as a region, which encompasses 14 unique and very diverse counties. So the analysis focuses on the period, or in the current period. So we looked at Q1 of 2024, and we also did some comparisons with Q1 of 2023, so that we can see the growth and we can be able to track the growth. So number one, we'll start with the utilization. So the slide that you see, and you can follow on the slide so that you can see the numbers. The slide paints a detailed picture of healthcare utilization in the region. So we're looking at a total claim value in Q1 2024 of 1.17 billion, and that's a very big number, if I may say, which represents a modest increase of 2% from the previous period, which is Q1 of 2023. And this is a key indicator of the overall health expenditure and utilization of healthcare services. Breaking it down, we see outpatient claims. So we've given you the overall, but we see outpatient claims have risen by 5% to 877 million, suggesting a higher utilization of outpatient services. And then conversely, we see that inpatient claims have decreased by 8% to 298 million, which might indicate either an improvement in public health, so admissions don't have to be as many, or a shift in patient preferences, where patients are preferring just to go for outpatient care as opposed to inpatient admissions. Interestingly, a total number of visits, so these are the visits that have been contributed by the patients that we have increased by 7%, indicating more frequent engagement with healthcare facilities. However, the number of unique patients, so this is a unique patient as Barbara, I might visit a facility a couple of times, but the number of unique patients has only increased by 2%. This could suggest that a smaller pool of patients is responsible for a larger number of visits. So possibly due to maybe chronic disease management or other ongoing care needs like medication refills and so on. So we also said as much we are able to look at the future. We are able to use our predictive models to forecast the future. So our forecast suggests that the total claim value could rise to 2.5 billion by the end of Q2 of 2024, marking a potential increase of 6% compared to the same period of last year. This anticipatory data can be critical for healthcare providers in planning resources. It can also be be very helpful in staffing, where if you're seeing that there might be a surge coming up, you're able to staff optimally so that you have staff to handle the patients that are coming, and you're able to anticipate the services for the coming period. So what does this particular slide mean for us? It signifies opportunities to optimize healthcare delivery, manage resources efficiently, and perhaps most importantly, to understand and meet the changing needs of our patient population. Because change is constant. Our patients won't stay the same all through. They have changing needs and they also have changing behaviors. So it's good to use data to be able to follow those needs and behaviors so that we can be able to meet them optimally. We go to the next slide where we look at the healthcare cost. So the slide zeroes in on the average cost. So this is the average cost per visit that is associated with different healthcare services based on our smart claims data for the first quarter of 2024 again. So we are seeing an average outpatient cost in the Rift Valley region of 5,000 shillings, which has decreased by 3%. So even though we are talking about inflation, we can see that the cost in the Rift Valley region has decreased for outpatient. This reduction could be attributed to efficiencies in service delivery or shifts in the type of procedures and treatments that are being administered. Maybe the patients are now seeking much cheaper services. So when we are analyzing the average cost, then it would come in a little bit cheaper. We also have dental. So with dental services, we see a notable decrease in the average cost by 5% to 8,000 in the current quarter. Such a reduction might reflect improved access to dental care or a change in the consumption of the dental services. We also see the average cost of optical services. It remains relatively stable because the change is very marginal. There's a very marginal decrease. So this might signal steady demand and cost management in that particular sector of optical. In contrast, we have inpatient. We move into the inpatient services, where we see there's been an increase in cost by 8% compared to the same period last year, averaging at around 100,000 per admission. This might be an indicator of more complex, higher cost procedures being required or an increase in the length of stays at the hospital. Lastly, the cost of maternity services has decreased slightly by 0.93%, so also a marginal decrease, standing out at 90,000 shillings per admission. This is inpatient maternity care. So this suggests that despite the critical nature of maternity services, there's a trend towards more cost-effective care, which is good for our patients. So collectively, we can see that the figures around costs not only inform us about the current state of healthcare expenditures, but also prompt us to consider the underlying factors driving these changes. Such insights are very valuable for you as healthcare providers for strategic planning. So if you're planning on maybe doing price restructures, it's good to go and see what are the prices in the market, because even though here we've broken it down into the different benefit types that we have on SMART, we're able to break it down per service level and go to the service level and tell you that a particular lab test costs this much. So we're able to look at that, and the insights could be very valuable for your strategic planning and ensuring the affordability and accessibility of healthcare. We move on to the patient population. So we've looked at the numbers that the patients are bringing, but who exactly are the patients? Who are the patients that are bringing these numbers? So we've uncovered insightful patterns in healthcare utilization by age and gender as the demographics that we've looked at. So we can see that the age band of 21 to 40 is the highest in terms of the ones utilizing healthcare in the Rift Valley region, and we see that the highest, they're also the highest in terms of female patient representation at 65%. This possibly could indicate a focus on reproductive health or early adult care, because that's usually around the childbearing age. For males, the utilization in this age band is significantly lower at 35%. So is it that the males are not getting sick, or is it that you're not going to hospital? hospital and waiting for it to erupt, yes? We also see the age band of 41 to 60 coming in next. This is usually the age band where chronic conditions become more prevalent. We have nearly equal representations in both genders, with a slight majority in females at 52%. Interestingly, now when we move to the younger age bands of 0 to 5, the youngest, in fact, there is a slight majority of male patients at 51%. I've heard that there's a male baby boom, so the data shows that in Rift Valley region, that's actually true. And this trend flips in the 6 to 10 age band, with 52% being females, a shift that could be influenced by various social-cultural factors or health-seeking behaviors. So again, going back to the patient behaviors. For the age band of 11 to 20 and 61 to 80, we again see a balance of near 50-50 split. So by understanding these patient demographics and these dynamics, it's very crucial for tailoring healthcare services to meet the specific needs of the different demographics that you're seeing, so that you can ensure that our healthcare provision is both effective and equitable. We move on to the pair and scheme analysis, looking at who drives business in the region. So on this slide, we examine the key pairs in our healthcare ecosystem, who are the ones who are giving you the most money or giving you the most business. So starting with the insurers or the pairs, we can see that the market is quite diverse. Old Mutual is coming in top at 16%, at a 16% share of the region, followed by CIC, and other notable contributors we see is Jubilee and Minet also coming up at 9% and 8%, and we can see the remaining 49% is distributed among various other insurers, which shows us that there's a very competitive field when it comes to the insurers, with a multitude of players. So even though we've shown you the top, there's this 40-something% that you can still tap into. Moving over to the corporate sector, we have a significant others at a category of 85%, so indicating a highly fragmented market with numerous smaller entities. Among identifiable corporates that come up, each holding a 3% share, are Safaricom, KRA, KCB, we also have KPLC and KWS coming up. So this, you can see it reflects a healthy mix of industries, government entities who have invested in the health of their employees. So by understanding this distribution, it's very key for us as it guides our partnership strategies and helps us tailor our offerings to the needs of these diverse pairs. We move on to the provider analysis. Who are the providers that are driving business in the area? And again, because of data protection, we anonymize the data subject, because as a provider, you're the data subject. So this slide will demonstrate the landscape of healthcare providers that are instrumental in driving business in the region, separated into outpatient and inpatient, because we thought it was important to do that separate analysis. So starting with the outpatient providers, we have a diverse set of key players, with Hospital 795 and Hospital 712, each accounting for 8% of services, so they've tied at number 1. This indicates a competitive outpatient market with no single hospital dominating the space, as evidenced by the 65% share held by the variety that we see under others. On the inpatient side, the distribution is slightly more concentrated. So we see the hospital that is coming up top, 2264, is at the forefront, providing 14% of the inpatient care, followed closely by Hospital 2700 and Hospital 567, each with a significant share of the market. And then again, we see the others who constitute of 44%, which is while it's substantial, it shows a greater level of consolidation in inpatient services compared to what we've seen in the outpatient services. So by understanding this distribution, it's very crucial to you as healthcare providers, as it points to where the demand of services is most concentrated, and it helps to identify potential areas for partnerships, benchmarking, or expansion for you as a healthcare provider. We move on to the clinical analysis, and as we look at the data, we gain valuable insights into the health concerns affecting our region. On the outpatient side, hypertension, I think maybe Ian had seen the data previously, but we see that hypertension ranks as the most prevalent diagnosis when it comes to outpatient care. This reflects a growing concern for chronic lifestyle-related conditions that warrant continuous monitoring and management. We also see nasopharyngitis, so the common cold, and hypermetropia, which is farsightedness. So I was actually trying to see in the room how many people have glasses, and it's actually a good number, so the data is actually telling us the truth. And this suggests that there's a need for robust primary care and optical services to address these common ailments. For our inpatients, the leading diagnosis is malaria in the Rift Valley region, followed by bacterial infections and fibroids, which is indicative of the infectious disease burden and certain specific women health issues within the region. Gastritis also appears both in inpatient and outpatient, signaling it as a cross-cutting health concern. These prevalent diagnoses are more than just numbers. They guide us on where to focus healthcare interventions, awareness campaigns, and resource allocation for the most impacts. We move on to the diagnostic services. We see that that this part of our presentation shifts focus to the diagnostic tests. And the diagnostic tests, as you can see from the screen, are a direct response to the prevalent health conditions or the diseases that we've identified in the previous slide. So we can make the connections. Number one, we see the CBC, the full hemogram, coming up. So as hypertension is a prevalent diagnosis in the region, the CBC is crucial for monitoring overall health and can provide indicators for conditions that may accompany hypertension, such as anemia and a host of infections. We also have H. pylori tests coming in at the top. So given the prevalence that we've seen in gastritis or gastro issues, the H. pylori test is essential to identify the bacterial cause and guide appropriate antibiotic therapy. Then we have CRP also coming up, and with CRP, it's an indicator of inflammation and can be elevated in the infectious conditions that we've seen coming up. We also have urinalysis and stool for ova and cyst coming up, for parasitic infections often present with gastro symptoms, because we've seen the gastro issues are prevalent in the areas. Moving on to radiology, we have OBS ultrasound coming in top, which reflects the importance of maternal health care and correlates with the attention given to conditions like fibroids. We saw fibroids coming up in terms of inpatient care, which can affect pregnancy. We also have MRI lumbar spine coming in top. This imaging can be linked to the inpatient diagnosis of conditions that cause chronic back pain or spinal issues, which may be underlying factors for hospitalization. And then we see the echo also coming up. So with hypertension, as we've seen, as a leading outpatient diagnosis, the echoes are very vital for assessing heart function. So it's a heart test, so it correlates with the hypertension diagnosis that we've seen. So these tests, they provide a window into the health of our population and the effectiveness of our healthcare strategies or our treatment types. By understanding the data, we can anticipate the needs, we can improve the outcomes, and we can also ensure our healthcare system is equipped to handle the most pressing health issues. I'll also look at medications because in Kenya, pharmaceuticals are taking the biggest chunk of utilization or the biggest chunk of spending when it comes to healthcare utilization. So we see the medications that are commonly prescribed in the region also reflect the prevalent health conditions and the results of the most frequent conducted tests that we've seen. For instance, we can see the augmentin and the other antibiotics that are coming at the top of the list, which correlates with the high incidences of bacterial infections that we've seen in the diagnosis or in the diseases like nasopharyngitis and gastritis. So it suggests that bacterial infections are a primary concern concern that our healthcare providers are addressing. We also have Nexium, or also Meprazole, is a medication for the gastro issues that we've seen coming up a lot. So tying back to the common diagnosis of gastritis and the regular testing of H. pylori, its prescription frequency aligns with our earlier insights on gastro health. We also have paracetamol coming in a lot, indicating its use in first-line treatment for fever and pain, common symptoms in various conditions, including malaria, common colds, when you have inflammation and when you have infections. And we also see the other drugs correlating to what we see. So each of the medications tells a story of the healthcare challenges in the regions. And we can be able to break this down by the diagnosis to show you the treatment types when it comes to the medications. So what does the future of analytics look like? Moving on to the next slide. As we look towards the horizon of healthcare, or the future of healthcare, analytics stands as the beacon guiding us to a more informed and personalized future. So the future trends depicted here are not just speculative, they are the pathways shaping our next steps, and some of them have already been mentioned by the previous speakers. So we have number one, precision medicine. This is where analytics gets very personal for the patient, tailoring treatments and preventative measures to individual genetic profiles and lifestyles and the risk factors. It's healthcare that fits like a glove, so it fits everyone. It's like what you're wearing and it's exactly your size. We also have telehealth and remote patient monitoring, which has been mentioned by Isaac and Esther. And the pandemic, as Moses mentioned, accelerated this trend, but analytics is what will sustain it. By continuously gathering patient data remotely, we can make informed decisions in real time, breaking down barriers to care. We also have the utilization of NLP, or natural language processing. With NLP, we'll be able to look at the unstructured data. So this is the data that is coming in from the providers in terms of diagnosis and the line items and UHC. With UHC, we are hoping to use NLP to be able to standardize this data. We also have more, and I'm being, the MC is behind there telling me we are bad on time, so meaning lunch is ready. So we also have the growth in consumer-driven analytics, where now it focuses on the patient, and the patient handles their own data and has their data in a portable way. And we have enhanced predictive analytics, where now we're able to predict diagnoses, predict disease trends, and be able to mitigate that. And we also have enhanced data interoperability. So this is where we are able to share data across platforms. And I think one of the speakers also mentioned on that. And we have enhanced decision support systems. And also Isaac mentioned on the same. This is where we are able to help clinicians to make the decision or to make the diagnosis based on large language models that are fed with a wealth of healthcare data. So I'll just finish off with our proposal. So what are we proposing when it comes to our analytics? So as we've explored the current landscape and the future of healthcare analytics, it's clear that the next step is actionable intelligence, business intelligence. So our proposal to help you harness the power of your data is number one. As Smart, we are able to offer you business intelligence dashboard modeling. So we offer live dashboards. These are real-time dashboards that provide real-time insights into your operations and will enable spot-on decision-making. And for in-depth analysis, where you have very specific asks, we also provide static dashboards or static reports, which offer a snapshot overview for strategic planning. We also have training services, where we believe as Smart that knowledge is power, and we want to empower your teams. So our training services will equip your staff with the skills to interpret data and extract meaningful insights, driving informed decisions. making at all levels. So it's important to note that our data capabilities or our data analytics capabilities are not tied to the claims data that we have on board, the smart claims data. It's extended beyond the claim, so we can come in and analyze even your whole suite of data, so including the cash paying patients, and give you an overview of how you're performing all around and a 360 view. So by partnering with us, you not only will be poised to navigate the present, but also you can shape the future of healthcare in Rift Valley region. I'll leave you with a quote by Peter Sondergaard. Ian wants to get me out of the stage, but the quote says, "Information is the oil of the 21st century, and analytics is the combustion engine." Thank you very much for your attention.
Thank you. Let's appreciate Barbara with a round of applause. The wealth of information that Barbara has. After lunch, I know she will be available for something that we usually call a fireside conversation. Fireside conversation, it's like sitting at the bonfire and having a conversation and be able to explore all the wealth of wisdom that she has. We'll make sure that, Barbara, would you be available after lunch to have this one-on-one conversation with the delegates that are here, more so on the presentation that you've given? All right, fantastic. So Barbara had given me a question that she'd like to offer to the delegates. If, once again, if you get this trivia question right, then you shall be able to get a gift package courtesy of our partners, Hako Industries. So which county do you think is the most expensive when it comes to outpatient healthcare cost? Lady over there? Nairobi? In the region, this particular region, Rift Valley region. Nakuru, sorry, that's wrong. A gentleman in the pink tie. Narok County, least expensive. No. Most expensive, sorry, it's not that. We'd asked for the most expensive. Most expensive, gentleman over here. Kericho, most expensive. No. Yes, gentleman here. I hope you're not with smart application. Yes? Uasin Gishu was the most expensive. Are you sure? 100%? Guaranteed? You talk to your pastor and that's the confirmation that came to your heart? 100%. Please, let's appreciate him as he comes on stage. The rest of us, we have so many goodies we're going to give you, all right? Please, once again, talk to the lower level people, subordinates. Tell them how it feels to be a winner.
Ni God, maze.
All right, we'll just come receive it and then make sure that we get the photo ops right there. Okay, thank you. Let's appreciate him and also Barbara with a round of applause. Okay, our team was handing over the lunch vouchers. We just want to make sure that you have all the lunch vouchers as we go to our final speaker for this particular occasion of ours. Is there anyone who doesn't have a lunch voucher? Please just raise up your hand. You can be able to come and give it to you. Fantastic. I believe we all have. Just in case no one has been able to receive, then now we can be able to guide you on that. Fantastic. Thank you. Now we want to go to our next and final speaker. Ladies and gentlemen, is a man who brings to this particular gathering a wealth of knowledge and experience and relentless passion for advancing healthcare with an emphasis on obstetrics and gynecology and fertility in Kenya and beyond. He has a Bachelor of Medicine and Bachelor of Surgery from Moi University and a Masters of Medicine in obstetrics and also gynecology. This is a man with a distinguished career that is spanning over 20 years, and he has been at the forefront of the medical innovation. He is the founder and the CEO of Nectar Gene and Fertility Center. Ladies and gentlemen, his expertise is not only confined in the hospital setup, but is also a lecturer, Department of Obstetrics and also Gynecology at the Egerton University Faculty of Health. Ladies and gentlemen, as they usually say, lend us your ears as we invite our next speaker. Put your hands together for none other than Dr. Justus Malowa Nondi as he comes forward to to give us his presentation. Let us lead and heed from his insights and the wisdom that Dr. Nondi generously imparts to the delegates that are right here on improving patient-centered outcomes and enhancing medical practice. One more time, let's appreciate Dr. Nondi as he comes forward. Glad to have you, sir. Welcome. Thank you very much.
Oh, good afternoon, ladies and gentlemen. It is not very easy to speak when the aroma of food is around, so I'm going to take the shortest time possible because I understand that science has never found the way to bridge the inverse relationship between hyperglycemia and knowledge acquisition. So, so allow me not to read what I had prepared, but to just share with you what I would call my pedestrian sort of experience. I call it pedestrian because I'm not an expert in these areas, but because of circumstances, I'm forced to be, to learn some of these things. When Mark Achola, and I hope Mark Achola is still around, nevertheless, and Mark Achola was here and I was talking about the rigidity with which healthcare providers were treating the issue of smart applications and all that when it was being introduced, I kept remembering, because even for me and Benjamin behind there, you know, when I was a young medical officer and I was working at the outpatient department of PGH Nakuru, the then med sup, Dr. Murima, such a great man, introduced the issue of paperless clerking and doing things there. And I was among the few people who are actually not very easy to handle at that time. So we had several altercations with Benjamin there, and he was very kind to me, trying to tell me how to appreciate this, work with this, clerk, use the ICD-10 then, to clerk patients and enter all these details into the system and all that. But over the years, I have been forced to, I would say forced, to appreciate this. And currently, I think I understand why smart applications and even the other kind of innovations that we're having are very important for us in the healthcare industry. You'll agree with me here, especially those of us who have the kind of training that I've had over years. You'll agree with me that medical school does very good things to us. But one of the things, and I should call it one of the disadvantages of medical schools, is that it really never teaches you how to be a medical entrepreneur. You know, as we just taught how to treat patients, and I in fact tell my staff members, and they are actually here, you can actually raise your hand, you know. I actually tell them that for me, the only thing I understand very well is how to treat patients. So the rest, you have to guide me on how to do. When Smart Company, came to my facility to work with us, I was not very enthusiastic in the first place because I didn't understand. But over the years, it is quite apparent that the kind of solutions we are getting from this company, are actually unmatched. I'm able to do a few of the things that they're talking to us about today here quite seamlessly well, that some of my colleagues think that I've had some superior training in some of these things, while the actual fact is I haven't. In the area where I studied mainly, in obs and gyn, particularly in the area of infertility, we have several patients that come to see us. Some of them come to see us from as far as Turkana and so on. Now, you can imagine if these patients didn't have some of these solutions available. For example, I'm able to connect with some of these patients and track them down the line in terms of even the kind of interventions we are doing with them. We have to do certain things involving imaging, and Smart Company has talked to us about issues of telemedicine and all that. We're able to then discuss and agree on patient appointments and scheduling so seamlessly well that when they come, they don't waste time. They get value for their money. Some of them travel from very, very far off places. And therefore, what I would say in this forum is that this kind of technology is spot on, is a kind of technology that medical practitioners really need to be schooled about. The thing that I would challenge the smart company guys to do is to find a way of entrenching this thing into the curriculum of medical schools in any way that you can. Just make it very important that this is something they have to learn in this 21st century, as the previous speaker talked to us about, you know? Because one of the things, the challenges we get in practice, particularly us in the medical field, is anything we don't know, okay? And that is how we are trained. Anything we don't know, we are told not to speculate so much about. Instead, we need to refer to the experts. In fact, in our training, you realize that if you are answering a question and you know you don't know that question, there's a column provided called don't know, DK. So you better say you don't know than say something that you think is the right answer and it's not. And when the person is going to mark this paper actually finds that that's a wrong answer there, they're going to penalize you. So that if you had 20 out of 50, and 20 out of 30, and then 10 out of 30 that is wrong, the 10 out of 30 will be subtracted from the 20 you got, so that you have a net of 10, and so on. So because of that, we tend to view some of these things very suspiciously, okay? We are not trained on issues like this. So when you approach us, sometimes in the hospitals, we are very rigid, okay? And I was just trying to discuss with Benjamin behind there that it would be nice to see that demo on how this kind of system is going to work for ward rounds, where you are walking from patient to patient and you're trying to be paperless, taking into account that you have to be real time at that point, you know, write instructions that are very clear, because as a consultant, for example, once you leave a patient's desk, a patient's bed, you need to be very sure that whatever you said there is what is actually going to be implemented. And luckily, I think one of the speakers told us that there's a place where this is working, and one person will be really interested in knowing how this can work, so that we can even pilot it for the different places that we consult with. I have seen Joy in the crowd. I have seen Philip. Philip, we've worked with you before. Okay. I've seen Caroline somewhere behind there, and many other people. My own nephew here, Owino, is in the crowd, and we interact at several levels in the place where he works. So some of these things I think we can pilot and see whether we can actually do them. One of the things that I'd want to challenge you to do as well is to bring particularly these consultants on the forefront of making this implementation of these things work, because the kind of environment where we practice in, the medical space where we practice in, for example, if I go for a ward round, most people will tend to take my word as gospel truth. Unfortunately, sometimes I may not be very, very accurate. Okay? Take, for example, I'm doing a ward round in PGH, and I said, this is how I need this patient to be handled. Now you can imagine if the consultant is speaking from this point of view, that we can only clerk patients in this manner. That way you'll give the administrators like Mark Achola easy time to implement these things. They'll not have to struggle trying to tell the doctors to do it. But the doctors can be very rigid. Eh? Yeah, so if you approach it that way, I think it will work very well. I don't want to take much of your time. Lunch is there. And it's been a very good opportunity to be here and listen to what the experts are saying and share my little experience about this. Nectar Gyne and Fertility Center, where I come from, or where I run, is particularly dedicated to offering fertility services to patients. Fertility is such a big issue. Actually, 1 out of 6 couples that you meet out there will be struggling with infertility. So we are trying to bridge the gap between the infertility cases and the solutions that we have, and we believe that some of these applications are going to be very integral in going to the extent of helping us make the patients get the right kind of services. Thank you very much. I wish to stop at that point.
Daktari, I have just been informed that you have one of the state-of-the-art clinics that we should be able to visit. Thank you so much for the wisdom that you've been able to share on that particular conversation, most importantly also on fertility. Please, let's appreciate our doctor one more time for such a fantastic keynote. We appreciate you. At this point in time, I would like to just make sure that I can be able to see Ndila from Smart Application and Team. Ndila, are you around? Yes, so what we want to do, we want to make sure that we can be able to give, yes, and the lovely Ndila is at the back there with her team. We want to make sure that we can be able to give our giveaway packages to the delegates who are here as you are seated. So the Smart Applications team is going to be going around and giving you their giveaway package. So please just, you can be able to allow them to do that. It's a token of appreciation from the organization just for your patronage and your support. At this particular point in time, we want to go for a very brief, we want to have a very brief Q&A session. And for this Q&A, we can just take probably 2 questions, but I'd like to call upon our group director at the healthcare business, Esther Masharia. Let's appreciate Esther Masharia, our group director, healthcare business. So I'll be giving it back to Esther. Esther's role as a group director at the healthcare business, she'll be selecting who will answer the question. It's a good thing being a group director, isn't it? You can either answer it or you can serve the ball to the team, all right? Thank you so much. On my end, I will be having the roaming mic. In case you have a question, raise up your hand, I will come to you, and then now Esther will be able to direct it. Welcome, Esther.
Good afternoon once again, thank you, Ian. It has been such an awesome morning. Tumesoma. You know a little bit about Smart now. The people who are saying we do not have an office, we have a very beautiful office in Nairobi. And in the countries that we are in, we have an amazing team that work on these solutions. We have cutting-edge technology that makes sure that our hospitals, our patients are well taken care of. So thank you so much for being very patient. I was just looking across the room and nobody was moving. I hope we have been taking notes, and we would be hearing a lot from a number of you. So we shall be here even after this to also engage with you. But for now, I want to go through a session where we'll have questions and also feedback on where we can improve. I know we had some question coming up through menti.com, but this is an opportunity for me to be asked a question or an opportunity for me to be given feedback, even as we receive the very beautiful giveaways. So anybody with a question, feedback? Yes, there's a gentleman on my right.
Good afternoon.
Good afternoon.
My name is Willie. We do have so much on the system and everything, but taking into contest on the CIA triad, we've, I think Purity, if I got the name right, talked about confidentiality and integrity. But there is an aspect of availability of the system since it's more web-based. So I wanted to know your incident response plans, and in case of a disaster, because these systems are controlled by power and such things, if you have a hot site, in case of such things that happen. Yes.
Thank you so much. I'm seeing Purity with bags, and she's supposed to take that question because she's a techie in the room. Purity, they're asking about the availability of the system going web. Are we going to have a hot site?
The answer is yes. So part of the things that we've researched on is to make sure that we maintain some of the capabilities that we also have on the desktop application, so that even if something is happening, for example, there is an outage, connectivity as an issue, that you can continue operating, then later synchronize. The other bit is that we've implemented redundancy measures, so that, you know, sometimes guaranteeing 100% uptime of a solution is quite a task, right? So what we've done is we've implemented multiple layers of failover to ensure that at any one point, and if at all we are going to have outages, then we have people on ground ready to respond within the shortest time possible. So those are the measures that we are taking, but some of the learnings that we will continue improving the system.
So what she's saying, that we are guaranteeing 99.9% uptime, even as we migrate to our web application. We're very keen on that because it's, like I said, it's a system where the person is in duress, so we cannot afford to have any issues on service availability. Any other question?
Yes. There's a lady here, but before we go to her, we can, with your permission, he had asked to give, he has an addition to the question. That's okay, Esther?
Okay.
Sorry, I forgot something. The system you said is going to be accessed like through facility and facility B, and they can get information from the other facility. Is there an acceptable use policy in that each facility will probably, in the contract, will have to sign an acceptable use policy so that information for the patient is not yet used inappropriately?
Definitely. One of the key things that we shall be having as part of the sign-up, Isaac highlighted that you shall be registering as a provider and users being able to register into the system. So as a provider, there will be terms and conditions and all the other policies, including the privacy and everything, loaded into the system, so that then you can be able to accept them before you even start registering your own users into the platform.
Thank you, Purity. So the next question. Please tell us where you are, which facility you're representing.
My name is Agatha Mumo. I'm the director of Acadian Counseling Center. And my question is very personal to the company. On the ground, on matters technicality, there's a team that supports us when we are stuck. I wanted to know, do you have a platform where we can give like feedback? For someone like Marciana, she's very patient with us, and I feel like she's the best. Is there a place I can just give that feedback to the company?
Oh, yes. Oh, and well done, Marciana, for that. Yes, there's a platform where you can be able to give us feedback. We have an email address, info@smartapplicationsgroup.com, or provider admin at smartapplicationsgroup.com. Andreas, please bring up those two email addresses. You give us feedback, we will be able to see that. Yes. But we also, on our new platform, we will have a way that we can have a chat capability with you, so that you can be able to give us that feedback. And well done, Marciana, noted. Yeah, and that's really nice. Okay. Any other question? Wow, okay.
Good afternoon, everyone.
Good
My
afternoon.
name is Robert. I come from Pearl Hospital in Nyahururu. So my question is, and I believe everyone is asking this question. So in case I want to bring the HMIS from Smart, what happens to my previous data? Is it compatible enough to be able to sync data all dating back, 3-4 years ago? Then the other question is, most of the struggle we have with these HMIS systems, we are told most of the things are possible, but kwa ground, mambo inakuanga imechemka. So now I ask, the part of emergency, I've not seen it. With emergency, I don't think we are able to bypass all those systems of triage, billing, and all that kind of thing. So is your system able to include other tabs, things like emergency, things like IVF, things, other things like that? And is it integratable with systems like PACS, where radiologists can report from off-site and be able to integrate it with the same system for HMIS? Thank you.
Justin, please answer those questions. those three questions, but on the issue of data migration, yes, we're able to migrate your data from the previous system onto our smart health system. But Justin will handle those questions.
Thank you very much. Yes, we're able to migrate your data. We have a team of experts that deal with data. So when we get the data from yourselves, we're able to get it in a way that, in a format that is able to be migrated to our platform. So then you asked another question regarding the integration capabilities. Yes, the system can be integrated to PACS. It can also be integrated to the lab equipment. So we'll be able to do the integration for you for the lab equipment. I hope I've handled everything.
Yes, you have. So yeah, it's possible. So on the issue of emergencies, I think that has been addressed. And what I can also assure the team is that even for the 21 years that we have had our product called MediSmart, we give that system for free. And on top of that, our support has been very, very consistent. We are very deliberate on supporting our customers. Customer experience is our #1 key pillar within the organization. So that's why you hear Kina Masiana, they are always available when you want them to be. And it's not just in this region. It's something that we have replicated across the country and the countries where we are at. The next question.
Maybe just to add something, Esther.
Yeah.
He had mentioned about the emergency and IVF. Yes, you are able to, during the process of registering that patient, there is a capability that helps you to create an emergency department so that when the patient comes through emergency, you can be able to identify them on the system. Then on the IVF, we have that capability under our data module. So you'll be able to also make use of IVF if you are offering those services. It is also available on the system. I didn't talk about it, but when we have our presentation, we can be able to showcase that to you.
Thank you, Justin. Yeah, next question.
We have the lady here.
Good afternoon.
Good afternoon.
My name is Harriet from Metropolitan Chemist Nakuru. My question is, what do we do in cases where we have these the smart access and we have patients who have skin conditions where they cannot read their fingerprints? Do you have an automatic, or can you have an automatic process where they are changed from fingerprinting to OTP? Because sometimes it wastes a lot of time when you have a long queue of patients waiting to have the insurances done.
Yes, that is already in place, where if the patient is not able to use their biometric fingerprint, they can now be migrated to the option of using a one-time PIN. Even as we have the smart access, that capability is there. We will check with you. Masiana, please check why that is not there, but that is already in the system.
Great. Was there a question also on this other side? Since we're here, let's give the gentleman and then we can go to the lady, then probably close on this one.
Okay.
Okay, good afternoon, everyone.
Good afternoon.
Okay, I'm Kim Tai from Mercy Mission Hospital. Okay, so my question are specific to maybe support. Okay, we've been having some challenges at times. They are okay. So at times, based on the software that we use, okay, we have a different software of linking with smart based on when a patient comes to an hospital. Now, at times for claiming purpose, the one that for us to claim the after the billing, for us to claim, we have a challenge of now discharging the patient via the system. So I don't know if there is a way whereby, based on you're having a different system or not a system or a different way, where I can use smart to capture everything without. Okay, let me use an example. There is a software that we use to link with smart. Now, after when you forward the claims to the smart, it's supposed to automatically, you are supposed to retrieve so that you discharge that patient. So is there a way whereby when I'm having a challenge with the software that I used, whereby I can capture it without making necessary a call to the support, or whereby I can just basically, I know you have understood my question. Now, for simplicity. Now, another question is, when I'm having a challenge of capturing that pre-auth, okay, I've identified there are two things under the when you are capturing that pre-auth. So there are some services that you can find. For example, if it is a procedure, you can find a procedure, and at the same time you can capture everything from consultation, dawa, everything. Is there a best way also I can just, for example, if it is a procedure of myomectomy and I find that service, I just place that service and the amount, rather than to nieke kila kitu one by one.
Thank you so much.
And also, on HMIS, for attachment of claims, it only requires less than around 100 KB. If you scan a document, most high likely it will be more than that. I don't know if there is also an adjustment in terms of the size.
On the EDI portal?
Yes.
Okay.
Thank you.
Okay, so you've asked a question on integration. I am not sure which system you're using, but maybe RX is. Where you're saying for inpatient, you want to be able to do what? Did anybody understand the first question? Smart team. Puri, did you understand that question?
I'm trying to, because you told us we've understood. So I'm assuming the challenge you're having is that when you're retrieving all the data is not coming, and you'd like to know whether it's possible to capture it on the smart solution, to capture the remaining data or whatever you're not able to capture on your system. Okay, so I think Alex and Tim, we need to look into that to understand what are the technicalities around that, because ideally, when retrieving, you're supposed to pull all the data that is in your system, unless if maybe there's a communication issue, but that's something we can look into and ensure that we sort it out, because it will be very hard to generalize, but mostly on the system, on our smart solution, it allows you to capture an item at a time. But I know that is very tedious for an inpatient, so let's look at it as an isolated issue so that we can have it fully resolved. There's another question that you've asked about pre-authorization in terms of
capturing the service.
Capturing the services on pre-authorization. Now, our pre-authorization is able to do at different levels. You can do at a benefit level, just outpatient, or just a single service, so that if you're billing for outpatient and you do not need any pre-authorization, you go all the way to the end. But if you go to bill for a radiology service that requires pre-authorization, it's only that particular service that you're going to seek for pre-authorization. I hope I've answered. Maybe we can talk on this side so that we can go further and understand. Yeah.
Kindly requesting maybe probably over lunch, perfect opportunity. We will get a table reserved for you and the technical team. Thank you very much.
So on the feedback on the attachment, the size of the attachment on our EDI platform, that we will take note of that and check it out. He said he has a challenge with that issue, Isaac. So we will take note of that. Any other question?
Okay, good evening. Is it evening or afternoon?
Afternoon.
Good afternoon once again. My name is Felista. I don't have a question. I'm just trying to respond to SMART, the services you are giving to us. I'm from Samburu County, Marara, Glofe Medical Clinic. I would like to appreciate SMART because, or even I can speak in Kiswahili. From toka asubuhi, English ndo ina flow. We are just speaking in English. Let us speak in what?
Kiswahili.
Kiswahili, and lugha ya taifa, si ndio? We are okay with that. So mimi ningependa kushukuru Smart kwa sababu ya services ambayo wametupa kwetu. Sisi tuko Samburu. You can imagine Samburu, far away. But I can hear people are saying, you people in Nakuru, you don't have the Smart, this health service Smart. Leave the Smart that builds, the other Smart, ambao ni hospitali. And I was hoping you people to be having that thing. My colleague there anasema kwamba the issue ya integration inakasta capture all the claims. But I can assure you, I've been using Smart, the other Smart, for the last 1 year. It has been doing wonders in our place. There's nothing that una capture it manually. Everything, it is integrated. Ukimaliza kubill client, who you capture, everything is being integrated. And it has become an easy thing in my place. Like I can give you a testimony. We used to have a lot of work. Tulikuwa na a lot of work because tulikuwa tuna print invoice and then tuna capture one by one. But since we were introduced to this Smart Health ambao ni ya system ya clinic, everything imekuwa easy. Nilikuwa na workload mob kwa my facility, everything imekuwa easy. At the moment, mimi niko Nairobi nasoma kwa sababu Smart has made my work easy. Can we clap for Smart? You can think it is something, it's a joke or something like that, but it's true. Nilikuwa na workload. I have madaktari, but still tuko na hiyo workload, you can imagine. But since we are introduced to this thing, it has made wonders to us. Nina print invoices, mimi nikiwa nimetuma. I print na kutuma. Hakuna issue mob. So you people of Nakuru, buy this thing. It is not expensive. You people, you are seeing a lot of people, watu wa maternity, a lot of things. Si kama me, I have just a clinic, I deal with outpatient. But you people kona inpatient, you promoting Smart, they will make wonders and do wonders in your facilities. Thank you.
Wow. I think, Isaiah, if we just ended that session here and went home, even if I went to ask for a pay rise, I'll get it. Thank you so much for that feedback. I think it's coming directly from my user who has really been with us and used the system for the last 1 year. And I hope the media team captured that testimonial because I would want to play it again and again. So we are available to implement our state-of-the-art Smart Health Plus. We have an awesome team that, and it's a system that we have developed in-house. We have not gone to India to pick it from there. It is ours, we've developed it, we customize it according to your need, and we shall be there. So thank you so much for that feedback. Anybody else with a question? Yes, Ian?
Esther, can we take the very last in the interest of time?
Yes.
That's
yes,
okay?
Yes, last question.
All right, with the permission of our director, we'll have the last question here with a comment, and then we can close.
Thank you. Good afternoon, all.
Good afternoon.
My name is Isaac Minor from Geothermal Development Company. Now, GDC being a corporate organization, it has come with a lot of blessings. Number one, we have attracted a lot of investors. Now that means we have also introduced a new problem because these investors, they are coming to inject their money in our projects, and they are saying that the money that they are going to give us are going to support a certain project. That means if I am in Nakuru and an investor comes to invest in Menengai, the money that they are going to give us, it should not be consumed by a staff who works in Nairobi or in Baringo. Now they have introduced another thing called commingling. We used to process those invoices from medical service providers as one. Now, in this case, the problem that I am foreseeing, from what I have observed from the morning when I got here, you've done a very good job as Smart to make work easier for the service providers, and especially the hospitals. But now we are at a point whereby, one thing that you've done to them is reduce the paperwork for them. But now these investors, the blessings that we've received as GDC, it has come with a problem. And that problem is a lot of paperwork in this case. Now, I was looking at a situation whereby the invoices come and we are needed to separate these invoices from where the principal member belongs. Staff from Nairobi, staff from Nakuru, staff from Baringo. Now, I thought maybe it will be easier for us, the way you've made it easier for service providers in terms of the system and everything, that you can also introduce a column for us. I know from the back office I have a place whereby I can edit somebody's mobile number, I can edit some other details, I can activate, deactivate. Can you also introduce a column whereby I can put where the principal member belongs to?
Okay.
Because I'm seeing a scenario whereby this problem of paperwork, you know, I think we are a customer to about half of these people here. So, and you know, a customer is always right. Now this problem, we are going to transfer it to them. Thank you.
Thank you so much for that feedback. This is really an amazing feedback, and thank you, GDC, for being here. They have been our customer for some time. Mwenjes, you've heard that request from Geothermal. Let us take it so that we can see that what enhancement we will do on that integration with GDC to add that extra column to make their work easier. So thank you. We will engage with you because now that is coming from the customer side, but it doesn't look like a complicated request. So yeah, thanks a lot. Monjera there will take it up. There's one more question that had is so raised we cannot ignore, but that should be the last one. So let's hear.
Good afternoon once more.
Yes.
My name is Jones Mokaya. Work from the Nairobi Women Nakuru CBD.
Okay.
So there is this challenge about coding on ADI. The following insurances: AR, Old Mutual, and KCB. Sometimes they do combine. Sometimes they don't reflect maybe immediately. So I'm kindly requesting you might integrate your systems so that they cannot take wrong time for coding. Once they accumulate on the other side, it needs more, let's say, adding more stuff to just code them once they're needed.
Wenjera, could you handle that question? He's asking about the enhancement on the payer side for AR or Old Mutual and KCB, so that when claims are submitted, they are received real time. But I know that is fully automated for Old Mutual. Mvojes, do you have a mic?
Thank you for that question, and I do understand the question. So basically what happens is there's a lot of mapping that needs to be done straight from the provider where you have your codes, and then as smart as the link between you and the payer, we need to map those codes. And the other thing is what the payer has on their end. We've been driving this with our HO team to ensure that the mapping has been done and the clinical team from our end. But the challenge that we usually find, and it's what I was talking about, is the completeness of a claim. You find that there's an item that you have added on your side that you have not shared with us for us to map, and also the insurer to map. So basically we do generate a report that we do share with the providers, and I'm sure you do receive that report, and we do follow-ups in terms of mapping. But once the claims have integrated to the payer, there are usually now there are processes that they usually check doing the clinical vetting. And if the data is not clean, whereby I was talking about something like you would have needed to indicate 2 diagnoses, but you only put 1. But one of the line items, because it's drilled down to specifics, they might reject that claim or take a longer time in requesting more documentation to prove that that claim is payable. So we look into that, and also I'll engage my team in the HO just to check what other issues that may be there. Thank you.
Thank you, Moses. But I also have a request for Nairobi Women's. A request that we have made for years. Let us get your HMIS and smart talking, because it's an inpatient facility and the bills there, they are humongous and we're not integrated. But that's a conversation for another day so that we can make that process very good. But I always ask that question every other time. So go tell Kinadan to make sure that we're integrated. So any other question? So thank you so much for the opportunity, and Ian, and tunawapenda sana.
The beauty about good leadership is collaboration with the team, and as the questions were being answered, I could appreciate how well versed Esther knows her particular team and who can be able to address that particular concern. Please, let's appreciate our Group Director, Healthcare Business, Esther Macharia, one more time. Thank you for your leadership. Also, Isaiah, thank you for your leadership as well. At this point in time, we are coming to the tail end of the program, and we want to come to the vote of thanks. To guide us on this is the Service Operations Manager in the Hospital Operations Department. Ladies and gentlemen, help me appreciate Mr. Patrick Kihato as he comes on stage to give us the vote of thanks on behalf of the organization. Welcome, sir. Glad to have you here.
Good afternoon. My name is Patrick Kihato. I've been in this region before. This is where I worked before I moved to Nairobi. And I'm very well versed with the majority of you. I can see quite a number of familiar faces. So I'm feeling at home. So mine is very simple. It's just to give a vote of thanks. And to begin, I'm going to say that I'm really pleased to be standing here before you on behalf of SMART to convey our gratitude for you for gracing this event. First of all, I want to thank God. He gave us an opportunity to be here. The weather has been favorable. I believe you've seen what is happening in other counties, but today God has held the reins for us. A particular mention goes to our guest speakers. I'm going to start with Mr. Mark Achola. Thank you for your candid testament of the SMART journey and being observant in terms of what SMART is doing. We can assure you that SMART is committed to do better and do more. We will come up with technology solutions that for healthcare facilities that not only solve your problems but also are easy to use. Also, a special mention is to Dr. Justus Nondi for your willingness to impact us with your wisdom, engage our audience with your captivating presentations which have enlightened us. I believe, Isaiah, what Doc has challenged us, you're going to take it up so that we can see to it that also the medical practitioners are also trained when it comes to using some of the technology solutions that we have. I also want to extend our sincere thanks to our internal speakers for your outstanding contributions to our event. The insightful presentations were inspiring and empowering, fostering collaboration with our partners. I would also like to thank the organizers of the event, the planners, those who participated to make sure that this forum was a success. I can see the marketing team being led by William. I can also see Winfred, and also, of course, not to forget Alex for collaborating with the team and ensuring that everything is well planned and becomes a success. Our gratitude goes to the Sarova team for hosting us, also to the team who made this beautiful tent so that we can be able to hold our forum in it. I'm also looking at the MC, Ian, well done. The SMART management, our colleagues who came to support us, Alex, you have some good friends who are willing to stand with you. So good work to those who came. I can see Caleb and Abanas in the house. Finally, to our main people, we want to thank the Rift Valley providers who made sure that they can spare some time today to come and make this event a success. Without you, it could not have been possible. We truly feel humbled for you making time to be with us this afternoon. Thank you for your continuous trust in our business. It brings us joy to serve you. Thank you.
Great. Let's appreciate Mr. Patrick Kihato one more time with a round of applause. Great. Now we've come to the very tail end of the program. Please give a high five to the person seated next to you and tell them it's a wrap. It's a wrap. It's a wrap. All right. Fantastic. Look to the other one on the other side and tell them that Esther Masharia is buying you lunch. Please turn to the other person. Tell them Esther is buying lunch. All right. Fantastic. We want to close off. We started off with a word of prayer, and we'd like to close off with a word of prayer. So at this point, I would like to call upon the mighty man of God, God's chosen vessel for such a time as this. I believe that he has gone to River Jordan 7 times, in there and out, and he has just arrived from a prayer center. I'm saying that on a light note. But please help me appreciate Mr. Paul Kirui as he comes to close off with a word of prayer. Welcome, Mr. Kirui, as you take us to the pearly gates of heaven. We are glad to have you here. Please let's appreciate him one more time.
Good afternoon. We can rise up on our feet for a word of prayer. Let us pray. Thank you, our Father, our Creator, the Lord God Almighty, who has granted us such a wonderful day. You have granted us journey mercies as we came here. And Lord Jesus, and Lord, as we go back to our homes and back to our workstations, we are going back having been more informed and more equipped for our work, so that we may serve the suffering, the ones who are coming to us as they are suffering, to ease their suffering. And Lord, as we depart from this place, we ask that may the same journey mercies that was granted as we came here, may it be more so granted as we go back. And we thank you for all things, and we thank you because all our coming together has been to all of our benefit, and we thank you for everything through Jesus Christ's name. Amen.
Thank you, Paul Kirui. I love what you said, especially as it says in the book of Isaiah that the Lord's word never returns to him as he speaks it, and I am confident that he never gathers his people in vain. All right, we've come to the very end. Thank you once again, Isaiah and Esther. Thank you for your executive leadership, and to the entire Smart Applications team. May the Lord bless you. Ladies and gentlemen, we would like now to break off for lunch. I believe that we have our lunch vouchers. I believe that we have our gift vouchers, giveaway token of appreciation from Smart Applications. Once again, we are going to be serving our lunch here. Please, once you serve, feel free to come and have your lunch. This is a place that you can be able to have it. And also, it would be a good session for us to be able to interact with the Smart Applications team. We are glad to have you here. Enjoy your lunch, ladies and gentlemen, and we are proud to be associated with you on behalf of Smart Applications. Smart Applications to the world. Enjoy your lunch, ladies and gentlemen. Thank you once again. Have a good evening.
Introducing Smart Access, the customer virtual access to healthcare. The app that does everything your medical insurance card does and much, much more. To download, go to the Google Play Store or Apple Store and download the Smart Access app. Once downloaded, register by creating a username and providing your telephone number or email address. A generated OTP will be sent to your phone or email address for input. Once you input this OTP, you can now proceed to use the app securely. Additionally, you can tag the app to your phone, meaning the app can only be used by that particular device and cannot be accessed on any other device. This is an additional security feature to safeguard access to your medical covers. The Smart Access app will enable you to get all your 1. Covers in one place. You can see your covers both inpatient or outpatient, and the same for all your dependents. The covers will be listed on the app and you can click on each to see the balances available. 2. Medical cover balances. On the app, you will be able to see the updated balances for each cover. This will be updated in real time and you can see your cover utilization. 3. Customer statements. On the app, you can request to see your last 10 transactions or even a full statement of utilization that can be sent to you on email. 4. Virtual medical card. The app will have your virtual medical card and you can initiate a hospital visit for you or someone else who is a dependent without physically being present at the hospital. To initiate a hospital visit, within the submenu titled My Cover, you click to Initiate Hospital Visit. It will give the code on screen and then send an SMS on the same. This is the code that will then be given to the cashier at the hospital as authorization for the hospital visit. 5. Mapped out doctors, hospitals, and other healthcare facilities. On the app, you can see different medical providers by location, specialty, or even accessibility under your insurance cover. 6. Health stories on the go. You can pick your health topics of interest and can see different stories curated just for you.